The Committee on Foreign Affairs will come to order. Without objection, the chair is authorized to declare recess of the committee at any point, and all members will have 5 days to submit statements, extraneous material, and questions for the record, subject to the length limitation in the rules. To insert something in the record, please have your staff email the previously mentioned address or contact full committee staff. As a reminder to members, please keep your video function on at all times, even when you're not recognized by the chair. Members are responsible for muting and unmuting themselves, and please remember to mute yourself after you finish speaking. Consistent with House rules, staff will only mute members as appropriate when they are not under recognition to eliminate background noise. I see that we have a quorum, and I now recognize myself for opening remarks. And so let me say, I'm very, very grateful for having this hearing, grateful for Chairman Meek's very aggressive leadership over the last several weeks to take on the issues that the administration is debating internally in these critical formative months. As we've all made clear, Democrats and Republicans, our job is not to support a particular administration, although many of us are very supportive of what President Biden is trying to do. Our job is to look under the hood, to advise, to provide oversight, and that's why we're here today. I think we all remember almost exactly a year ago, we had Secretary Pompeo before us, and we were supposed to be talking about strikes in Iraq, but many of us were concerned that the US government wasn't taking seriously enough the looming crisis of the COVID pandemic. So that became the focus of our hearing. Since then, our country has been hit tremendously hard. Our focus as a country has turned inward on saving American lives, on healing the American economy, on rebuilding American supply chains. And yet the COVID pandemic is perhaps the most obvious example in any of our memories of why the United States is connected to the rest of the world, why we have to be a leader in the world. The virus came from somewhere else. The virus does not respect borders. And it is an incontrovertible fact that we, the American people, are not going to be safe unless and until everyone in the world is safe. Because if this virus is raging in Africa and Asia and Latin America and in Europe, we know that there will be new variants. Even if we are all vaccinated, we will be at risk. So beyond the moral obligation that we have, there is a strong practical need to try to make sure that we're doing our part to help others. Now, reports suggest that the United States has secured enough doses of the vaccine to vaccinate twice our target population. That Europe has purchased 2.3 billion vaccines for a population of 450 million, more than twice the need. So that's something that we want to explore here today. Obviously, we've had to secure security for ourselves, public health for ourselves first. But given the self-interest and the moral obligation to ensure that the pandemic is being crushed everywhere, how can we best use the supply that we have secured to do that? The good news is the United States is back in a leadership role in this effort. We are supporting COVAX. We are leading, not retreating from international institutions. We are not going to be ceding leadership of the WHO, for example, to China. I think that's a very good thing. And I think we have a chance to use this crisis as an opportunity to remind the world that the United States of America, that our people and our leadership cares about human life everywhere. In some cases, we may even care about human life more than the governments of the people whose lives are being threatened. That is an opportunity to reassert American moral and strategic leadership that I hope we will seize. Now, pursuant to the notice, we will be meeting today to hear from distinguished witnesses who will give us their assessment of the international impacts of the COVID-19 pandemic and what the United States, all of us, should be doing about it. And to kick us off, I will now recognize Representative Andy Barr for his remarks.
Well, thank you, Mr. Chairman, for holding this hearing. A little more than 15 months ago, we first began to see reports coming from Wuhan, China, about a new SARS-like virus. The reports were troubling, and experts around the world began to express concerns about the virus spreading. But we were assured by authorities within the Chinese Communist Party the virus was not transmissible from human to human, a sentiment echoed publicly by the World Health Organization. Of course, we now know that behind closed doors, the CCP was doing everything it could to cover up the virus. They were silencing doctors and arresting journalists who dared to tell the world the truth, while destroying samples and shutting down labs who were racing to discover what this novel virus meant for the world. And as the Republican Committee report on the origins of the COVID-19 discovered, the CCP never actually warned the WHO of the outbreak as required by the international health regulations. Because of the CCP's cover-up and the WHO's deference to the CCP, it took weeks that were critical in stopping the spread of the virus for the truth to come out. Now, a little more than a year after the WHO finally declared a pandemic, we face a worldwide death toll of 2.6 million people, including 535,000 right here in America. Those numbers demonstrate the heartbreaking impact felt because of this virus and the devastating effect of the CCP's cover-up. But these numbers sadly only show the surface of the true fallout from COVID-19. The economic, political, and physical ramifications of the virus is putting countries and regions that were already considered fragile at risk of further destabilization. We've already seen a rise in food insecurity, extreme poverty, and increased deaths from other diseases like HIV/AIDS, TB, and malaria. And as this virus spreads chaos and fear, authoritarian regimes, terrorist groups, and hostile nation states will try to take advantage. The U.S. has been a leader in providing global health and development assistance for decades, and now Congress has provided over $15 billion to help control the spread of this deadly disease and mitigate its long-term impact. We cannot truly bring an end to this pandemic here at home without fighting the pandemic overseas, and I support funding for global efforts to combat COVID-19. That's why I was so frustrated the Foreign Affairs Committee was shut out of the reconciliation process, especially when Leader Hoyer assured us this process would be bipartisan and involve all relevant committees. This disenfranchisement of our committee members is not the way we were supposed to operate in Congress. A partisan rush to pass, even though this is a bipartisan issue, was prioritized over a sound policy process. And without our committee's input, we abdicated critical oversight responsibilities. I would like to ask for unanimous consent to enter into the record a letter from Ranking Member McCall and Ranking Member Reich that was sent to Secretary Blinken urging rigorous oversight of the $10 billion provided through the American Rescue Plan.
Without objection.
These funds must be implemented with clear U.S. government branding and spent only when we see additional money from other donors. Especially with skyrocketing domestic needs, it is critically important that every dollar is targeted, strategic, and effective. There is hope on the horizon, however. More and more vaccines are being distributed every day. U.S. companies, thanks to Operation Warp Speed, have created an astounding 3 vaccines in record time. It's truly historic. Over 71 million Americans have received at least 1 dose. Worldwide, that number tops 225 million. Increasingly, our private sector has played a significant role in helping small and medium businesses survive the pandemic, including by connecting them with new markets abroad. Cooperation between governments, NGOs, medical experts, and the private sector is the key to an effective response. Again, I want to thank the chairman for this hearing and thank our panel for joining us today. We look forward to your testimony and examining the international impact on COVID-19. And with that, Mr. Speaker, I yield back the balance of my time.
Thank you, Representative Barr. I now yield 1 minute each to the chair and ranking member of the Subcommittee on Africa, Global Health, and Global Human Rights, for their remarks. Chair Bass, you're now recognized. Chairwoman Bass, are you there? I don't see you. So if you're not here, then let's go to Ranking Member Smith for 1 minute. And he may not be there either. Let us move then to our witnesses. Dr. Ashish Jha is a physician, health policy researcher, and currently the Dean of the Brown University School of Public Health. He's recognized globally as an expert on pandemic preparedness and response, and has led research and policy advice around Ebola, currently on the national and international COVID-19 response. Thomas J. Bollyky is the Director of the Global Health Program and Senior Fellow for Global Health Economics and Development at the Council on Foreign Relations. He's also an adjunct professor of law at Georgetown University and founder and managing editor of Think Global Health, an online publication examining the intersection of health, economics, society, and everyday lives. Previously, Mr. Bollyky served in a variety of positions in the U.S. government, most recently at the Office of the U.S. Trade Representatives. Tjada McKenna is the Chief Executive Officer of Mercy Corps, leading a global team of nearly 6,000 humanitarians who provide immediate relief to save lives and livelihoods for 29 million people in more than 40 countries. Previously, she served at CARE, Habitat for Humanity, and in the Obama administration at USAID as assistant to the administrator for the Bureau for Food Security. And finally, Penelope, or Penny Naas, is president for International Public Affairs and Global Sustainability at United Parcel Services. Previously, she worked for Citigroup and Global Government Affairs, overseeing the various legislative and regulatory issues that arose after the 2008 financial crisis. Penny started her career at the Department of Commerce, conducting anti-dumping and anti-subsidy investigations on foreign companies. So why don't we go to Dr. Jha, please, first.
Great. So Chairman Manowski, Ranking Member Barr, members of the committee, it is my honor to be here with you today. We are more than a year into this global pandemic that has infected and killed so many people around the world. And there are many lessons from this pandemic, but here's one essential lesson. We live in a deeply interconnected, interdependent world, and an outbreak anywhere can quickly become an outbreak everywhere. And here's the second lesson. We are now entering an age of pandemics. Global disease outbreaks will become more common. Why? Several factors, including deforestation, climate change, broader economic development, and globalization. But before we focus on future pandemics, let's talk about how we get through this one. And to get through this pandemic, we must first understand its global impact. That's why I'm so pleased that this committee is holding this hearing today. Here at home, the pandemic has been devastating, but I believe we are finally turning the corner. We have seen steep declines in infections and deaths as millions of Americans are getting vaccinated. This is terrific, but we aren't done. We still have challenges ahead of us. Variants now make up as much as half of all infections in the US. The actions we take now, particularly to accelerate vaccinations and maintain public health measures, is critical. Let me be clear about this. It is essential that we maintain basic public health measures until every high-risk person who wants a vaccine gets one. I suspect that will happen sometime around mid to late April. After that, we can safely begin to relax public health measures and get back to our lives. Globally, the picture is different. The COVID-19 pandemic has had a profound negative effect on the world. While officially 120 million people have been infected, most estimates suggest that the true number of infections is probably well over 1 billion people. And while the official death toll is 2.6 million, the real death toll is substantially higher than that. But the impact of this pandemic certainly goes well beyond health. The IMF estimates that the global economy has seen the greatest decline since the Great Depression. And of course, the pain of that economic decline has been disproportionately borne by the world's poor, with hundreds of millions of people thrown back into poverty after years of gains. We have seen education disrupted, not just here in the US, but across the globe. And it has hit poor children particularly hard. For them, education is the ticket out of poverty. At the peak of school closures last April, the estimates are that 94% of children around the world were out of school. And the pandemic has harmed our political systems as well. Freedom House reports that pandemic has worsened democracy and human rights in 80 countries. We've seen increases in authoritarian behaviors from leaders around the globe. We need a vigorous, multi-pronged, multilateral approach to bring this pandemic to an end by vaccinating a large majority of the world. Now, the landscape for global vaccination is complicated. COVAX is one major entity trying to get vaccines out to low and middle income countries. But individual nations are sending their vaccines to other countries before vaccinating their own citizens, practicing what's called vaccine diplomacy. The two biggest leaders of vaccine diplomacy are Russia and China. COVAX estimates that it will have about 2.2 billion doses by the end of 2021. That is not enough. We need a strategy to vaccinate every high-risk person in the world quickly, and I believe every willing adult by the end of 2021. That's probably close to 5 billion people, or the equivalent of 10 billion doses. That's an ambitious agenda. How do we get there? So Congress has allocated $4 billion to COVAX. I think that's a great start. But the biggest problem actually isn't money, it's the vaccines and the need to substantially expand vaccine production. That's why I was heartened to see the recent efforts by the administration to bring Merck in to make J&J vaccines. We need to continue to push on expanding vaccine production, and we need to fight vaccine nationalism. And we need to work with countries on other aspects of fighting the pandemic, such as greater availability of testing, PPE, and other critical materials. A year ago, we as a nation walked away from WHO in the middle of a global pandemic. This harmed our national interests and allowed China to step in and play a bigger global role. But it still left a global leadership vacuum. Rejoining WHO, funding COVAX are all good starts, but we must do more to bring this pandemic to an end. And because, as I said earlier, we are entering an age of pandemics, we must build the surveillance systems, the health systems, and the resiliency needed to respond more effectively to future health crises. Thank you so much for having me, and I yield back.
Sorry, I was muted. Thank you so much. Let's now go to Mr. Bollyky.
Thank you, Chairman Malinowski, Ranking Member Barr, and the other distinguished members of this committee. I'm honored and grateful for this opportunity to testify. The topic I will address today is the global inequity in COVID-19 vaccine distribution and the importance of U.S. leadership in resolving it. My remarks will proceed in three parts. I'll give an overview of the current U.S. engagement on this problem, a summary of the three emerging circumstances that would justify increased U.S. engagement, and last, a proposal for a U.S.-led initiative to increase the capacity, transparency, and resilience of vaccine manufacturing to produce sufficient quantities of vaccines and related materials in this and future pandemics. Let's start with current U.S. engagement. So the largest vaccination campaign in world history is underway, but many nations remain excluded from its benefits. 4 months into the global rollout of the COVID vaccines, approximately 400 million doses have been administered globally, but just 10 nations are responsible for 3 out of 4 of every dose administered. 75 countries, representing approximately 1 billion people, have yet to administer a single dose of vaccine. In efforts to bridge this global gap between vaccine haves and vaccine have-nots, the United States and other wealthy democracies so far have opted to donate funds rather than early supplies of doses. In February 2021, G7 nations pledged $7.5 billion to the multilateral initiative known as COVAX. This Congress generously appropriated $4 billion for this purpose, including $2.5 billion that will go to vaccine procurement. COVAX is committed to distributing 2 billion doses by the end of the year, but progress has been slow, especially relative to the vaccine rollout in wealthy nations. As of March 15th, COVAX has shipped 29 million vaccine doses to 46 countries. Widespread immunization remains a distant prospect in most nations. The African Union doesn't expect to vaccinate 60% of the continent's population for at least 3 years. It is understandable that Democratic leaders answerable to voters have opted to give cash rather than share early vaccine supplies at a time wherein each dose provided abroad is one less dose available at home. But three circumstances that have emerged that increase the U.S. interest in global production and distribution of COVID-19 vaccines and related supplies. The first is the aggressive diplomacy being practiced by China, Russia, and other autocracies around these vaccines. Many countries that were unable to compete with wealthier nations for advanced vaccine purchases or unwilling to wait for COVAX to deliver have turned to unproven Chinese and Russian vaccines. China is currently donating vaccines to 43 nations, Russia to 13, India to 40, and then there's a handful of smaller donations by 4 other nations. Most of these donations are small amounts. China and India are pledging, on average, fewer than 300,000 doses per country. Russia is providing donations ranging from 60 doses to 500,000 doses. Keep in mind, all the pledged vaccines require a 2-dose regimen. These donations are not being directed to the nations where the coronavirus crisis is currently the most severe and where early doses may do the most good. 42 out of 43 of the countries to which China is donating are participants in its Belt and Road Initiative. Russian donations are being directed through oligarchs and Russian firms. Yet at a time when governments are under extreme domestic pressure to roll out vaccines and they have few alternatives, countries will remember who came to their assistance and when. And where vaccine donations are going, it is possible that increased influence for China and Russia may follow. The second circumstance is the emergence of variants. The only effective strategy for reducing the risks of more contagious, deadly variants, potentially more deadly variants, is reducing new infections, which will require increasing US and global vaccination rates and making more vaccines. There is already a finite supply of manufacturing capacity and supplies that will be put under greater strain if we need to produce the next generation of vaccine candidates to protect against emerging variant strains. The third circumstance I'll just briefly note is the emergence of supply shortages and disruptions. COVID has placed an enormous strain on manufacturing capacities and supplies, and there are manufacturer delays in delivering promised doses and shortages of raw materials, single-use components, and vaccine-related supplies. In response to those shortages, the EU, India, the US, and others have imposed export restrictions. They are hindering the ability of COVAX to deliver doses around the world. They also threaten to hinder the production of the billions of vaccines we need for other infectious diseases like polio, diphtheria, tetanus, and so forth. The US needs a 3-part strategy to respond to this challenge. The first,
Mr. Bollyky?
Yes, sir.
We probably don't have time for a 3-part strategy because your initial 5 minutes is up, but I'm sure you can work it into the questions that I know we will throw your way. So I am going to exercise my absolute power as temporary chair to call on Ms. McKenna for 5 minutes. And then we will come back to the important themes that have already been raised. Thank you.
Thank you very much, Vice Chair Malinowski. Representative Barr, Ranking Member McCall, and the other distinguished members of this House Foreign Affairs Committee for convening this hearing. I would like to submit my written statement for the record.
Certainly without objection.
Thank you. My name is Tjada McKenna, and I am the Chief Executive Officer of Mercy Corps, an international humanitarian and development organization. Our global team of 5,600 humanitarians operates in 40 countries, where our work improves the lives of more than 37 million people. When COVID-19 hit, our team members redoubled their efforts to support communities in need. Despite travel restrictions, supply chain disruptions, and limited funding, we adapted our programs to continue providing life-saving relief and critical development programs. We helped communities from Western Niger to Kandahar province to protect themselves against COVID-19. I hope you will join me in recognizing the courage of those in the NGO sector working on the front lines of this crisis. Around the world, the effects of COVID-19 are threatening hard-won development gains by exacerbating food insecurity, poverty, gender inequality, and violence. These trends have the potential to be equally or more deadly than the virus itself. The same inequities the pandemic has magnified here in the United States are playing out abroad. But whether in South Sudan or Yemen, the communities are bereft of social safety nets or federal stimulus support. Barely anyone can work from home in the communities that we as Mercy Corps serve. Hunger is on the rise due to income loss, market disruptions, movement restrictions, and a dramatic increase in food prices. The World Food Program now estimates that 271.8 million people are acutely food insecure or directly at risk of becoming so because of the pandemic. This is an 82% spike from this time last year. The World Bank reports that COVID-19 will push 115 million people into extreme poverty, the first time in 2 decades that that metric has increased. COVID-19 is exacerbating global conflict at every level. In many places, government responses to COVID-19 are fraying community trust in authorities. There has been a proliferation of misinformation, enabling armed groups to expand their influence. According to one forecast, 13 countries are likely to experience new conflicts in the next 2 years due to the pandemic. On March 18, 2020, 1 in every 45 people globally needed humanitarian assistance and protection. Today, 1 in every 33 people globally need aid to survive. That is a 235 million people total, a 40% increase over last year. U.S. global leadership is urgently needed to meet these unprecedented crises. First, I thank Congress for providing international assistance in the American Rescue Plan. I urge this committee to ensure that USAID and the State Department obligate these resources expeditiously. Need will continue to outpace assistance. I encourage this committee to support increases to the humanitarian, development, and conflict prevention accounts in the State and Foreign Operations Appropriations Bill in fiscal year 2022, focusing in particular on long-term development investments to help communities endure future shocks. U.S. diplomatic action is urgently needed to galvanize global giving and to ensure that other governments and the private sector step up to do their part. Second, I urge the U.S. government to build on its recent contribution to the COVID-19 vaccine access facility, affectionately referred to as COVAX by many of us, by supporting equitable global vaccine access. This will require a diplomatic push with local governments to ensure that excluded communities are engaged and participate in local vaccine rollouts. Lastly, this committee should ensure the U.S. government takes action to prevent the rise in violence that drives humanitarian need and undermines development. In 2019, Congress passed the Global Fragility Act, a law that originated on a bipartisan basis in this committee to strengthen the U.S. government's approach toward conflict prevention. I encourage you to ensure the Global Fragility Act is implemented and funded. Thank you very much.
Thank you so much for that testimony. And then finally, we will go to Ms. Naas for her 5 minutes. Thank you.
Thank you. Good afternoon, Vice Chairman and members of the committee. My name is Penny Naas, and I'm here representing United Parcel Service, UPS. Thank you for having me here today. I will focus on how UPS has been involved in global pandemic efforts, the ongoing vaccine rollout, and in supporting an inclusive economic recovery, and in all cases, our belief in the value of public-private partnerships. I would like to start by recognizing and honoring the 540,000 frontline workers of UPS, whose hard work and perseverance has been inspiring. I am thankful for their service. To this committee, I want to share my gratitude to you on your commitment to international assistance and the role you play to advance US leadership and protect US interests while also doing good. For us at UPS, the last year has brought a new purpose and commitment to the motto we live by, moving our world forward by delivering what matters. With both pride and responsibility, our company has played an essential role in every stage of the global response to COVID. Beginning in February of last year, we were engaged in supporting government emergency responses. And in the US, we partnered with FEMA to support Project Airbridge, which sourced and distributed much needed masks, gowns, and gloves to healthcare workers. Globally, we mirrored these public-private partnership models with many countries in support of their emergency response plans, including the Philippines, Singapore, the Netherlands, and much of Africa. With the support of international leadership from the G7, our industry was designated an essential service, and our fleet of drivers and pilots continued to deliver essential goods to those in need globally. Of course, our delivery volume was also a lifeline for people at home, delivering items from medicines to school materials to hair cutting tools. And we also saw a growing reliance of our customers, the retailers, on digital engagement and e-commerce sales, changes which will very likely endure long past the pandemic. Now today, UPS is focused on moving the COVID-19 vaccines and ancillary supplies. Since the first shipment in December 2020, our network has delivered over 93 million doses to more than 46 countries. Moving vaccines is complex, with expedited movement in cold and ultra-cold chain custody, with strict adherence to security, regulatory, and authenticity protocols. It is a highly sophisticated and data-enabled process, but this complexity is not a barrier to vaccine equity. UPS Healthcare and the UPS Foundation are moving quickly to support delivery programs that meet the needs of the most vulnerable and hard-to-reach populations. In collaboration with COVAX, Gavi, the Vaccine Alliance, and CARE, UPS will initially facilitate the delivery of 20 million doses for countries that have not had sufficient access to vaccines, including for top priority groups like healthcare workers. The role of public-private partnerships is a vital component in building global solutions for global challenges. UPS goes beyond our traditional services in making these arrangements work for everybody, providing in-kind logistics expertise to NGOs to manage and streamline deliveries. We also provide end-to-end cold chain transportation services and donate ultra-low temperature freezer capacity needed to maintain vaccine viability. One example is the work we have done with Gavi and UNICEF.
Hey, David, with the virtual viewing and discussion.
I'm sorry?
Everybody mute, please.
One example is work we have done with Gavi and UNICEF to transport the first COVAX shipment of vaccines in Africa and Ghana. Working with Ghana's Ministry of Health, we work to transport vaccines to dosing sites using Zipline, a drone logistics company, which the UPS Foundation helped finance in 2019 to rural areas lacking cold chain storage. This partnership has delivered more than 12,000 doses to rural Ghana and allows vaccines to go from facility to destination in as little as 15 to 30 minutes with no impact on temperature. Last, and looking to the future, UPS has continued to focus on keeping our commercial customers in business. At UPS, we are particularly focused on making sure this recovery effort reflects our company's values of inclusion and we are working to help our micro, small, and medium-sized customers. As World Bank and OECD studies reveal, women have experienced a disproportionate economic impact from the pandemic. And so we have pivoted to help address the specific needs of women entrepreneurs and small business owners via our Women's Exporter program, quickly developing training courses to support them and help them to pivot to the online retail environment. We've partnered with governments and international institutions such as the International Trade Center, which has enabled 6,000 women and small business owners to continue operating around the world in 2020, indicating again the power of public-private partnerships, which can have a far and impactful reach if structured effectively. So in conclusion, of the many lessons we count today in our reflection of COVID's impact on the world, there is no doubt that the focus the pandemic has brought to cooperation of stakeholders, particularly when the private sector and governments can work together, should be among the changes that we reflect on and preserve. Thank you for the opportunity to testify, and I look forward to your questions.
Thank you. Thank you all for your testimony. I will now recognize members for 5 minutes each, and pursuant to House rules, all time yielded is for the purposes of questioning our witnesses. I'll recognize members by committee seniority, alternating between Democrats and Republicans. If you miss your turn, please let our staff know, and we'll do our best to come back to you. If you seek recognition, you must unmute your microphone and address the chair verbally and identify yourself so that we know who is speaking. We will begin the questioning with Representative Sherman.
Thank you, Mr. Chair. Our committee, or should I say the Asia subcommittee, was the first to have hearings on the COVID crisis. And as we move, and I commend Mr. Bera, I believe that was his first as chair of the Asia subcommittee. And as we move forward, we need to appropriately criticize the Chinese Communist Party while protecting and embracing the AAPI community in the United States. Now, Mr. Barr, in his opening statement, blames the Chinese Communist Party for hiding key facts about this disease. And I might add that the Chinese Communist Party has not allowed the kinds of investigation that would allow us to determine whether this came from the virology lab in Wuhan or whether it came from an animal source. They have covered up, they have concealed, and it's my experience in life that the innocent are less likely to hide evidence than the guilty. We may never know exactly where this virus came from, and the Chinese Communist Party should pay the full reputational cost to how they mishandled this in its early months. But blaming the WHO for believing China and the Chinese government ignores two key facts. First, the WHO has no source of information not under the control of the Chinese Communist Party. And we do. We have the most expensive intel system, and I think the best in the history of the world. And we didn't have to take what China said at face value, but unfortunately we did. And one thing we have to determine is whether our intel community failed to tell us what was happening in Wuhan, or whether the leadership we had at the time failed to listen to the intel community. As Mr. Malinowski points out, we have a strong interest in preventing this disease from spreading worldwide. A moral interest and interest in world leadership. Our economy requires trading partners, and as he points out, wherever this disease spreads, it can mutate and come back to us in a worse form. There are those who say that we've failed because we didn't give up vaccine that we needed to other countries. There are other failures that are far less defensible. One of those is that it took us many, many months to get companies that didn't develop the vaccine to start making the Pfizer and Moderna vaccine and to get that licensed. Only after months of pounding by me and others did our country, did we finally get those licenses. Second, with regard to these vaccines, we told people administering them, get 5 dosages out of the bottle and then throw the bottle away. Well, there's 6.5 dosages in that bottle. Now we waste about 1 dosage per bottle, because if there's half a dosage left in the bottle, we throw it away rather than getting some out of this bottle and some out of the next bottle, same manufacturing lot. But finally, we have failed to do the dosage studies necessary in order to get these vaccines approved as quickly as possible. They only tried 1 dosage. There's a lot of evidence that that dosage is double or triple the number of milligrams necessary, especially if the person you're immunizing is under age 55. Yet even Dr. Fauci has refused and has said, well, we don't need to do any more research on this because it won't help America. We won't get the results until the summer. And by then, well, we'll have enough vaccine for America. Dr. Jha, are you aware of any studies in the world where we're seeing whether a much lower dosage of these very valuable vaccines can provide immunization, at least to those under age 55?
Congressman, thank you for your question. We are doing it in children in the United States, but in terms of adults, I think there are many of us who've called for studying the lower dose of these vaccines for exactly the reasons you've outlined. I'm not aware that those studies are happening.
And the other thing is that while manufacturing capacity in the U.S. is now being used under license, is there manufacturing capacity in India or elsewhere that could help make more of these valuable vaccines but don't have licenses from the United States?
Sorry, is that a question for me?
Yes, that is.
Okay, sorry, sir. Yeah, so this is the issue in front of us, is how do we expand manufacturing capacity? There's a lot of manufacturing capacity that is being used. India's got a lot of capacity, but it's being used for AstraZeneca and for Novavax. But I think that work of finding additional capacity is not done, and we need to continue to work on finding it. It's not an easy thing. You can't just stand up a factory overnight, but we need to be making more investments on expanding manufacturing capacity in India and elsewhere.
We need dosing studies for those between the ages of 18 and 55.
Absolutely.
It could save an awful lot of lives. They just probably wouldn't be American lives, and I yield back.
Thank you so much, Mr. Sherman, and thank you for pointing out some of those very important facts about our capacity to know what's going on. I'll now yield 5 minutes to Representative Barr.
Thank you, Vice Chairman Malinowski, and thanks to all of our witnesses. I want to especially thank Ms. Naas and UPS, not only for your important presence in the Commonwealth of Kentucky, but for all of the great work that UPS has done on vaccine delivery, delivering over 93 million doses to more than 46 countries. Our thanks to you, and it's a reminder of the very valuable contributions of the private sector in the fight against COVID-19, not just the pharmaceutical industry, but UPS as another great example. I do want to focus on the World Health Organization issue for any of our witnesses. The House-China Task Force, on which I was proud to serve, found that the WHO was a co-conspirator in covering up the COVID-19 outbreak in Wuhan, parroting the CCP propaganda and disinformation leading to millions of deaths worldwide. Last year, Secretary Pompeo stated that the leadership of the WHO was corrupt and that the pandemic was a direct result of the Chinese Communist Party covering up and doing it with a complicit World Health Organization. Now, Mr. Sherman has seemed to excuse the WHO from this status as a co-conspirator on the grounds that they don't have an intelligence arm. I would simply submit that any organization, any international body that disregards the untrustworthiness of the CCP and blindly accepts their propaganda is either incompetent or more likely a participant in the malfeasance. We have seen the WHO fold to pressure by the CCP before.
Will the gentleman yield?
If I could just get this question out, Mr. Sherman, what reforms do you all think are necessary at the WHO? Because I think, Mr. Sherman, this gets at what we all should be focused on, and that is, what reforms do you think are necessary at the WHO to make sure a cover-up like the coronavirus never happens again? Any of the witnesses?
I would put forward, thank you for the great question, Ranking Member. I would put forward several, and I would also commend to you the Council on Foreign Relations, where I work, recently convened a task force to look at these very issues. The thing I would point out with regard to the World Health Organization in China is, in terms of the assessment in our report, China was clearly, or the World Health Organization rather, was clearly too credulous of the claims China was making, and they were a week late in declaring a public health emergency of international concern. The World Health Organization is a member state organization. Its tendency to defer to countries in crisis is not particular to China, and we saw similar patterns in West Africa and the Democratic Republic of Congo. What we need is threefold. First is a surveillance system, hospital-based sentinel surveillance system that is not dependent on the transparency and self-reporting of directly affected member states. We need a reform to the emergency committee that forms as part of the process of declaring a public health emergency, so that is more transparent and rigorous. And last, we need more clarity as to what the international health regulations require in terms of information sharing, because that lack of clarity has led to numerous nations, not China, just China, to be slow to turn over information.
Well, on a related point, I am worried about China's vaccine diplomacy, as many of the witnesses also pointed out. And it's, I think, part of China's Belt and Road Initiative. And I think it's, I think their vaccine distribution efforts with substandard vaccines, when they haven't even addressed their own population, could be have a very negative impact. My question is, what is the effect on the fight against the virus if China engages in vaccine diplomacy with vaccines developed in secret and not accepted by the larger international community? And how are we going to make sure that the WHO doesn't give their stamp of approval on a vaccine we do not know is safe?
Let me try this, Congressman. A couple of things. First of all, I think it's incredibly important that these vaccines go through a regulatory approval, kind of the same kind of rigorousness of the European Medicine Agency, the US FDA. And I have encouraged countries around the world to not just take clinical data from a study that might have been published in a journal, but to make sure that these vaccines are rigorously evaluated. WHO has a list of regulatory agencies that should be doing a careful evaluation of these vaccines. I think that's important. I worry a lot about the vaccines that we've seen so far from China. They're clearly much lower efficacy. I don't know how safe they are. I suspect they're safe, but suspect is not evidence. So we need a lot more openness and data. And I have encouraged countries to make sure that these things go through a proper regulatory evaluation.
Dean, thank you very much for your testimony. I yield back.
Thank you, Representative Barr. And if I could just allow myself a brief comment, if believing Chinese spend on COVID-19 makes you complicit in their malfeasance, I assume that would also go for an American president who throughout February and March said that China and President Xi were doing a fantastic job, despite overwhelming evidence to the contrary. I now yield 5 minutes to Representative Barra. Thank you.
Great. Thank you, Vice Chair Malinowski. And, again, want to applaud all the witnesses for the work that you're doing. Certainly, appreciate Dr. Jha, the work that you've done over this past year to educate the public and get us through this. And Mr. Bollyky, the early work you did with our committee when we were, taking steps to address and get ahead of this pandemic. And Mr. Sherman rightfully pointed out that in early February, we did have the first hearing on the pandemic. And, obviously you hope this is a once in a lifetime pandemic, but as we've seen, with increasing frequency over the past 2 decades, we've had outbreaks of SARS, MERS, certainly Zika and other outbreaks, and that is what's going to happen in an interconnected world. So I know, Dr. Jha, you and I spoke a few weeks ago. It is going to be important to look backwards and understand the lessons learned in how we ended up where we are, to take the politics out of it, but also to understand the politics. But at this moment in time, as we look to stop this virus and beat this virus, both domestically and abroad, we have to be strategic about this as well. We're throwing billions of dollars at building a public health system here in the United States that we deserve, but we're also going to, we talked about vaccine diplomacy, and other members have, and the importance of the United States showing leadership here, both in this great power competition with China, but also part of the global response has been the lack of the United States leading over the past 12 years. So I applaud the Biden administration for the return. I applaud the announcement that came out of the Quad Leaders conference last week, where the United States, Japan, India, and Australia will move to provide vaccine and manufacture vaccine for the Indo-Pacific. I guess a few questions, as we look forward and better understand, the impact of this vaccine, maybe this is for you, Dr. Jha. We are seeing the emergence of the variants, and again, thus far, we're lucky enough to have 3 very effective vaccines here in the United States that work well to prevent serious illness, to prevent hospitalization, prevent death. But to get to our domestic population, why is it so important that the United States gets our vaccines out there to the rest of the world in the context of the variants, and potentially what could happen if a variant emerges that is a little bit resistant to some of the vaccines?
Yeah, so Congressman, thank you for that question. I think this is possibly the most important question in front of us, because right now we are on track to vaccinate all American adults by May to June. That's fantastic, and it leaves us in very good shape. The problem is that we're not on track to vaccinate the world anytime soon. And variants arise, they're somewhat idiosyncratic, but the more infections there are, the more opportunities there are for variants to arise. And so if we continue seeing large outbreaks in places like Brazil or South Africa, or increasingly in the last few weeks, India, but elsewhere, what you're going to see is you're essentially giving more opportunities for variants. And therefore, in my mind, the big worry, which I think is not a high likelihood event, but would be pretty catastrophic, is imagine the emergence of a variant that essentially renders our vaccines useless. Now, we haven't seen that yet, but I don't feel that lucky given where things have been over the last year. And so if we really want to protect the American people, we want to have a very, very, very aggressive global vaccination strategy. It also turns out to be the right thing to do for the world. It shows our moral leadership. There are many, many very good reasons to do it, not the least of which is it's good for the American people.
And maybe in the few moments I have left, Mr. Bollyky, we are in a great power competition and great influence competition with China, and certainly we're seeing Russia there as well. Can you perhaps summarize the stakes and why that vaccine diplomacy is so important to our relationship with the rest of the world?
Absolutely. So ultimately, nations are at a moment of crisis now. They're under tremendous pressure from their population and public health need to start rolling out vaccines, and they have few options. 88% of high-income countries are distributing the Pfizer vaccine, but the distribution in middle-income countries is highly correlated to the Russian vaccine and to China's vaccine, because they're the only ones they can get. Countries will remember who came to their aid in moments of crisis. What we need to do is present a compelling alternative to the token and strategically driven donations we're seeing out of China and Russia. We need to launch an Operation Warp Speed for global vaccine manufacturing. WHO, COVAX cannot do it alone. Scaling up manufacturing quickly requires financing and policy support, as the U.S. experience has shown. We need to see a corresponding effort like that globally that can do the same. We should build it in a way that has a vaccine manufacturing network that's flexible and robust and can respond to future pandemic threats as well. Because as you rightly noted, we may refer to this as a once in 100-year crisis, but there's no reason that should be so. The next virus could be emerging at any time, and we need to have the tools to respond to it.
Great, thank you. And Mr. Vice Chairman, I'll yield back. Uh-oh, did the Vice Chairman freeze on us?
Oops, sorry, it keeps unmuting. Thank you so much for pointing that out. Representative Smith is next for 5 minutes.
Thank you very much, Mr. Chairman, Chairman Malinowski. It's nice to see you. Let me just ask you a couple of questions. First of all, in 2020, Africa had fewer cases of COVID-19, about 3.5% according to the African Centers for Disease Control and Prevention, and fewer deaths in other parts of the world. They credit robust containment and a younger population as factors. But the emergence of variants that are more transmissible and deadly has now resulted in a fatality rate in 2021 that is above the global average. Matter of fact, as we all know, Tanzania's president, who was a pandemic skeptic, has just passed away, reportedly from COVID-19. So we may have a problem with statistics, with infections going unnoticed and undocumented. I also, and Ms. McKenna, I'm glad you brought up the food insecurity issue, which I bring up every chance I get. I have a bill pending along with Karen Bass that would really create a strategy to make sure that the locusts, which have not been silenced and eradicated the way they ought to be, in part because of COVID, and they are destroying crops at an unprecedented level in many parts of Africa and some parts of Asia. So my question there is, maybe you want to elaborate on the need for doing more to ensure that food insecurity, 40 million people or so in East Africa are food insecure. And finally, a question about the efficacy and safety of the Chinese vaccination, Sinovac and Sinopharm, and any others. You know, Francis Collins, obviously director of NIH, when he was asked by an Axios reporter what the Trump administration got right in the effort to fight COVID-19, he gushed, and I watched it, about the safety, efficacy, and unprecedented speed in approving and disseminating life-saving vaccinations. He praised Trump's Operation Warp Speed and said that they brought all the parts of government together in this is his words, an unprecedented way to test up to 6 vaccines in rigorous trials, close quote. He pointed out that nobody really thought it could happen other than the president and some of his top people. But in December, there were 2 vaccines that had gone through trials of at least 30,000 people, and it had been judged to be safe and effective through the process. He called it just breathtaking. Now, my concern, and some of my colleagues have also related to this as well, are the vaccinations, the vaccines, I should say, coming out of China or anywhere else, are they passing such vigorous protocols to ensure safety and efficacy? And again, with it looking like Africa may be seeing a prevalence spike vis-a-vis the rest of the world, how can we best help them with these vaccines that have been proving to be so safe and effective here in the United States? I would yield to to the distinguished panel.
Congressman Smith, I'd love to take up your question of food security. Thank you for asking. Sorry, excuse me?
Yes, please do. Thank you.
Thank you for asking that. I actually had the pleasure of leading the U.S. government's food security program for many years. As I mentioned earlier, we now have 271 million people acutely food insecure. And several factors are explaining this. One, the pandemic has decimated wage and remittance incomes. 2, it's disrupted food supply chain, so inputs aren't reaching farmers, pastoralists can't reach their pastures. People aren't being able to go into the markets to sell their foods. And third, in some places, the pandemic has disrupted the systems that help combat the effects of food insecurity. So as health systems focused on containing, and as schools close, many children in Africa especially rely on school feeding programs. Many families rely on programs like Food for School that send food home for families who are in acute food need. There are several tools at our disposal that we have been using to fight this and to really push for greater food and nutrition security. We're delivering cash and voucher assistance to promote economic well-being and to promote local markets. We also are able to do that with a greater distribution of funds using electronically and contactless. But we think we can do more here and encourage the U.S. government to increase the use of multi-year emergency programming to allow us to help households recover in what could be a prolonged crisis, as some estimates are that the vaccine won't roll out until 2023 in some places. We need to increase cash-based assistance that allows households to meet their needs. We have to support local markets. Our extensive research has shown that in times of crisis, people rely on local economies and markets for their food. And finally, we have to continue to encourage USAID to break down the internal silos between its bureaus to ensure that development, peace building, and humanitarian programs coordinate and build on one another. This has to be a comprehensive response.
Thank you so much for that excellent answer and guidance. If I have time, anybody want to tackle the safety and efficacy of the Chinese vaccines? And is it time that our vaccines are shared? I remember in the 1990s when one of the big pharmaceutical companies suggested to combat the HIV/AIDS pandemic, global crisis, they were willing to give away the drug at cost in order to ensure that people were safe. And I'm wondering if that information needs to be shared to save people's lives.
Mr. Smith, your time has expired, but I do think we want to hear an answer on the efficacy of the Chinese-Russian vaccine. So,
Tom, I thank you very much. Thank you.
If anybody has a quick answer to that,
I could just 1 second. Look, there's a lot of information out there about the Chinese vaccines, the Russian vaccine. They're often come out through press releases. They come out in medical journals. What we need, the reason I have so much confidence in J&J, Moderna, and Pfizer is not just because they went through the FDA regulatory approval, but through that approval process, hundreds and hundreds of pages of data were released about adverse events, about efficacy, different time periods, different doses. That information is what is needed about all the vaccines before you're going to really build confidence. I have not seen that level of detail about any of the Chinese vaccines. I have not seen that level of data on the Russian vaccine. And until that information is available, it is hard to say with any certainty how safe and effective these vaccines are. I suspect they are, but suspect is not confidence. It's my best guess. And we'd love to see data.
thank you so much.
Thank you so much, Mr. Chairman.
We'll now yield 5 minutes to Representative Liu.
Thank you, Mr. Chairman. I want to commend all the witnesses for coming today and offering your expertise. I want to note that a little over a year ago, Secretary of State Mike Pompeo sat before the Foreign Affairs Committee and in response to my questions, 6 times he refused to say the coronavirus was not a hoax. And now I'm hearing from the Republican ranking member that somehow the World Health Organization is complicit in some sort of fraud. Well, let's look at the facts. In April, Politico published an article talking about our former president. The title of this article was 15 times Trump praised China as coronavirus was spreading across the globe. So if you're going to criticize the World Health Organization, you got to criticize Donald Trump, who went even further than the World Health Organization and simply parroting what China said at the beginning of this pandemic. So instead of rewriting history, we should look at what would help U.S. national security. And my view is being a part of the World Health Organization helps U.S. national security. So I'd like to ask Dr. Jha, is it your view that the United States being a part of the World Health Organization is good for America?
Representative, to me, this is a no-brainer. The answer is absolutely it is good for America for several reasons. First of all, as we've discussed, it's really important that this pandemic be brought to an end. And many, many countries around the world depend on WHO's expertise and guidance on all sorts of issues. Second, there are a set of essential services only WHO can do, the way that they can bring people together, set rules about clinical trials, et cetera. And the question that has been in front of us is, do we want to be part of the global effort to stop this pandemic, or do we want to try to go it alone? And this is not a question in theory, because when we step away, we see others step into that void and take on a role. So I think it's very, very clear to me that WHO needs reform. It needs changes. We are far more likely to influence WHO in a constructive way if we're part. If we walk away, we will have no voice in that reform. And while WHO is only one part of a global health architecture, it is essential. It's the one place where every country comes together. And therefore, us not being part of it really leaves America much worse off.
Great. Thank you. I want to commend UPS for what you've done in distributing vaccines across America as well as around the world. Really appreciate your efforts. And I had a question for you, Ms. Napoli Naas, which is, what is your mask policy at UPS?
Sorry, sir, our mask policy. So are you asking about specifically in our facilities in the United States as well as for our drivers, or globally?
Yes, for at your facilities and for your drivers.
Yeah, so our mask policy is that, like with many employers, we encourage mask use. And I believe that I don't have responsibility for the United States, so I need to come back to you specifically on it. But I know in my own office, it's a requirement that you wear a mask. So
great. Thank you. I appreciate that. Now, Dr. Jha, I'm going to ask you a series of questions that may seem basic, but they just need to be asked. The three vaccines in the United States, Pfizer, Moderna, and Johnson & Johnson, they work, right?
They do, sir.
And everyone should get these vaccines when they're allowed to do so, correct?
Absolutely.
Yeah. I note that the former president of the United States hid the fact that he got the vaccine, but he still got it because he clearly believed it worked. Now, when someone is coming in the United States from, let's say, South Africa, Brazil, or the United Kingdom, we don't actually know if they're carrying a virus, right?
Not unless we have tested them thoroughly, Congressman, we would not know, right?
And that's why we want everyone around the world to be vaccinated, not just those in America, correct?
Yes, one of the many reasons we want everybody in the world vaccinated, absolutely.
Okay. Also, masks work, don't they?
Masks are very effective at preventing transmission, and good quality masks prevent you from also getting infected.
And that's because this virus is spread through respiratory droplets. And when you talk or cough or sneeze, you can spread it on doorknobs, at businesses, anywhere you go, correct?
That's correct. And through aerosols, which also people can breathe in. So masks are also helpful there.
Thank you. I'm sorry I had to ask all these basic questions because they're just some of my colleagues across the aisle who continue to reject science. I yield back.
Thank you. Our next questioner will be Representative Tjada. Representative Tjada, I yield 5 minutes to you.
Thank you very much. Before I get to my question, just a couple of quick points in response to the previous questioner. I would just note that Dr. Tedros, World Health Organization, was a shill for the PRC for China, defending China's abhorrent behavior, China covering up what was going on there, putting the world weeks, a month behind on what the breakout was happening, and allowing their citizens to travel across the globe and spread the disease, cornering the market on PPE, putting the world at risk. And Dr. Tedros essentially was the spokesman defending China in the early stages of this. And that was one of the principal reasons I think the previous administration took the somewhat unprecedented step of pulling us out of the WHO, an organization that is critical. We need it But when you have somebody like that at the top who was China's person, it's just they did considerable damage, incalculable damage to the rest of the world, to the United States, since we've lost over 500,000 of our fellow citizens. But let me get to my questions. Ms. McKenna, let me go with you first. As you may know, a couple of years ago, I introduced the Girls Access to Education Act along with my Democratic colleague, Robin Kelly. The legislation, which did ultimately become law, it is now the law, prioritized education in our humanitarian assistance to girls who were in conflict areas, who'd been displaced, and there was no education for them, so that it said that should be a priority. So I'm concerned about the impact that the COVID-19 pandemic is having on access to education, specifically to those girls abroad who are already not getting the education that they needed, that they deserve, because their country happened to be either in a civil war or having, all kinds of things that occur across the globe. It's my understanding that millions of girls dropped out of school as a result of the pandemic, as boys did as well. But this legislation was specifically aimed to help girls, and that they might never return or have the opportunity to return to a classroom due to child marriage or scarce family resources or other things. Now, I know we could always use more funding, but putting that aside, just more resources, are there any other things that we could do to help those girls to get back into school?
Thank you very much for the question and for your longstanding support for the education of girls. It's critically important. As you mentioned, COVID-19 does pose an even higher risk to girls' education and well-being. Girls are schools are closed. A lot of girls depend on that for safe spaces. They depend on that for food. They depend on doing that to help prevent marriage. And so we are seeing an increase in girls out of school and being very vulnerable. We also worry about what is happening to these girls when they're out of school. We are working, we're working really hard to do things to help those girls in school so that they don't lose a lot of their gains, so that they can go back. Our Nigeria team identified a way to work with radio in coordination with local governments to deliver lessons in English and mathematics over the radio. We also were able to provide students with workbooks. In Kyrgyzstan, we've supported 224 schools to hold remote reading camps. But I think your question on this also points to the importance of really doing comprehensive programming. Programming against COVID is not just vaccine and arms. It is doubling down on programming to help mother-in-laws and communities understand why child marriage is a bad idea. It's doubling down anti-violence programs for girls who are now maybe stuck in households where there is violence or other trauma. We really have to be addressing all of these things and not just vaccines and arms or the medical response when we look at this crisis.
Thank you very much. I had some more questions, but I see I've got 8 seconds left. So at this point, I'll yield back. Thank you, Mr. Chairman.
Thank you so much. We'll now go to Representative Wild for 5 minutes.
Thank you, Mr. Chairman. I'd like to direct this question to Dr. Jha. Dr. Jha, the district that I represent, which is the Greater Lehigh Valley of Pennsylvania, includes several of the country's most innovative medical manufacturing companies. One of these companies in my district is OraSure. They have developed a rapid home test for COVID, a highly accurate test that an individual can take and quickly get a result, much like an at-home pregnancy test, rather than having to book an appointment, go to a public place and wait for the result to come back from a lab, or mail a test to a lab and wait for a result. They've completed clinical trials and they are preparing FDA submission imminently. Another company in my district, US Specialty Formulations, is developing a COVID vaccine that would be given in a single oral dose. No needles or medically trained vaccinators needed, and their vaccine would not require refrigeration. If these products are approved and brought to market or from OraSure or US Specialty or other companies, could you discuss the impact they could make in defeating the pandemic, particularly with regard to developing countries?
Yeah, so Congresswoman, thank you for that terrific question. And let me take both of those things on. We still very much need rapid home tests. Rapid home tests, antigen tests, but there are other technologies as well, will be incredibly important because of several reasons. One is even when we have a large majority of our population vaccinated, the virus will not be gone. It will not magically disappear. We're going to have to deal with it. Having home tests will be a very important part of that, especially if we're not able to get to 90 or 95% vaccination. So it'll be critically important for us to open up our economy, to make certain high-risk activities safer. It'll also be important for much of the world. Many places may not be getting these vaccines for a long time. You know, on the oral vaccine, it certainly would be a potentially quite a remarkable advancement. Many advantages of having an oral vaccine. You don't need syringes. You don't have to worry about sanitation issues of the same kind, meaning reuse of needles and other things that can get people into trouble in other countries. You know, I have children who would be delighted to take oral vaccines over shots. So there are probably plenty of Americans who would find that innovation to be quite remarkable as well. But to be serious, both of those things, if they were to come to fruition and be effective and authorized by the FDA, I would see them as really important advancements in the global fight against this pandemic.
And you particularly piqued my interest in talking about the need for at-home tests to be available even as vaccines become more and more readily available. Can you expand on that both in terms of the US front and abroad? Why are these at-home tests still going to be necessary?
Yeah, this has been a little bit of a source of frustration for many of us who have been advocating for more testing availability for the American people and to take away the need to have a prescription. I mean, look, as a physician, I understand the value of having prescription-based testing, but I've really believed, many of us have, that having widespread availability of testing at home makes a very big difference. If you can test yourself at home on a day you may not be feeling well, and if you're positive, you will tend to isolate and not infect others. And then there's very good modeling data and other types of data that says if these were widely available, it would have made an enormous difference in the fall and winter before we had vaccines. But even under the best of circumstances, we're going to have outbreaks, hopefully small, hopefully containable in a post-vaccinated world. And therefore, having home tests are a really good way of catching them early and stopping them before they end up infecting a lot of people.
And could you just comment generally on the importance of having at-home tests or rapid tests in underdeveloped areas that are less likely to have up-to-date or nearby medical facilities?
Yeah, absolutely. So this is another really important issue in many places around the world. Access to physicians, nurses, other types of healthcare providers is limited. They're expensive. People have to pay out of pocket. And so especially for the world's poor, the ability to do rapid testing, have access to it, can make an enormous difference in helping people get diagnosed early in the disease course, isolate before they infect other people in their community or in their family. So again, the availability of rapid tests can be a very powerful tool in fighting this pandemic everywhere, but particularly, I think, in low resource settings.
And I assume that would include rural areas here in the U.S. and elsewhere?
Absolutely.
Thank you so much. I yield back, Mr. Chairman.
Representative Wild. Thank you, Representative Wild. We will now go to Representative Wilson for 5 minutes.
Thank you very much, Chairman Malinowski, and it sounds good, Chairman Malinowski. As we begin today, I want to thank Ms. Naas. We're very fortunate here in the Midlands of South Carolina. We have a UPS hub right next to my house. And so I certainly appreciate the thousands of jobs that you've helped initiate. And I know what a important corporate citizen you are. And so thank you for your participation today. And the U.S. private sector is leading the way on ingenuity and innovation in responding to the pandemic. And a classic case, of course, is the example of Merck Johnson, their cooperation, which clearly was initiated and begun under the Trump administration. This should not be a partisan issue. because it's clear that it was initiated prior to January the 20th. At this time, how can Congress and the United States government offer and better support U.S. private investments to combat the pandemic, particularly in developing countries?
Well, I can start and say, as I said in my opening remarks, Congressman, the most important, I say most important, but certainly a central part of getting the pandemic under control globally is vaccinating the world. And right now, the problem is vaccine production. It's not dollars per se, though money is always an important part of this. And vaccine production doesn't happen magically. It does require innovative approaches from the private sector. So I think if we think about the manufacturers right now who are producing these vaccines, if I were advising Congress or advising the president, I would say, we've got to get these manufacturers together. We really have to look at what unused manufacturing capacity is there in the world right now. There's probably not a lot. How do we do more at-risk purchases so that companies, if they make investments, they know that there's going to be a market afterwards for them to sell into. So there's a series of steps that I think are absolutely critical that the government, the U.S. government can play in helping expand the vaccine supplies for the world.
And hey, I'm glad to see that. And indeed, as the former co-chairman of the India caucus, I know how the pharmaceutical industry of India is extraordinary. And what a great alternative to another country located in Asia. But the bottom line is, working together, we can make a difference. And Ms. McKenna, how effective has USAID been in its programs to address challenges around the world? And what can we do to assist the USAID in their efforts?
Thank you very much for that question, Representative Wilson. The USAID and the U.S. government at the beginning of the pandemic was very, very effective at allowing us greater flexibility within the envelope of money that we had to redirect things towards that helped in COVID, like water, sanitation, hygiene, and other matters that were helping, and prevention and information. So we thank them for that. The amount of new money that were available were limited, but the American Rescue Plan also helps that. So several things that the USAID can do is to continue focusing on comprehensive reform, comprehensive programming, and not just the health programming. As we've said, the economic impacts of this have been devastating. We have lost decades of gains in eradicating global poverty, and that just creates a host of other problems. We'd also encourage USAID to start looking at the Global Fragility Act and looking at ways to prevent conflict. And we also need to think about multi-year response to this. Unfortunately, in many areas we serve, it will be a long time before the vaccines are distributed and taken widely. And so we're going to have multiple years, potentially even into 2022, 2023. So we're going to have multiple years of this and multiple years of those long-term secondary effects. So we really do need to think of this as a longer-term comprehensive problem and needs to have those similar solutions.
And thank you for your thoughtfulness. And Mr. Bollyky, the United States is now in a downward trend on the pandemic. And we understand, of course, that it began in Wuhan, China. And despite the World Health Organization, I think, as my colleagues have stated, it has been subverted by the Chinese Communist Party. But with that, should we be optimistic about the rest of the world in terms of a downward trend?
I think it's going to largely depend on how quickly.
I think we're not hearing you very well. Yeah, I think we're having some technical difficulties with your feed, Mr. Boyd.
For the rest of the world, for countries that keep the country, have you for Greece's that I'm trying.
I think while we work on that, and I'm sorry to cut you off.
Chairman, I'm sorry that, hey, but thank you very much, Mr. Chairman, for your good work.
Thank you, sir. I will now yield 5 minutes to my good friend, Congressman Phillips, to ask an incisive question.
Thank you, Mr. Chairman. I was going to direct my first question to Mr. Bollyky, but I will afford him some time to get back online. And thank you so much to our witnesses for being with us. Mrs. McKenna, I'll direct my first question to you, and it's relative to disinformation. You had mentioned a rumor tracker in your remarks, and I'd love it if you might speak for a moment about its efficacy relative to countering disinformation and misinformation as it relates to vaccinations and the pandemic.
Yeah, so we know, we've learned from our COVID work that building community engagement and trust is essential. And a public health crisis like this is only exacerbated by places with weak governments, with that mistrust in government and mistrust in public health officials. So with the rumor tracker, we've been piloting the rumor tracker, and we've also done kind of several other things like that, using digital data to push out other messages. What it does is it kind of picks up what people are hearing and allows us to just address it directly, and to address that source of misinformation, right? We're not hinting around it. We're not saying, we're not talking in generalities, because it's just very important for us to combat rumors and promote safe hygiene practices. But also, a lot of this is used and taken advantage of to create scapegoats, to marginalize certain populations further, to exacerbate mistrust, and to come up with people have all kinds of things they think this is meant to do when you let that flourish. So really getting to the root of that and really working with actors like us and my colleagues, my other peer organizations who have good relationships with these local communities is quite important.
So is it fair to say that NGOs can and should be playing a significant role in combating disinformation?
We have to. We are the organizations working in the areas with people that are hardest to reach and with people that are the most vulnerable. And we will not solve this without working with people that already know these communities well.
Thank you, and we're grateful to you for that. It looks like, Mr. Bollyky, you're back online. Welcome back. At least you didn't become a cat.
No.
I want to speak about corruption. As we're all aware, U.S. Customs recently seized more than 100,000 counterfeit masks bearing the 3M label that were shipped from Hong Kong, likely just a drop in the river of counterfeit goods that flow from China and other countries to the United States. Mr. Bollyky, you addressed the importance of supply chain transparency in your testimony a bit, but I'd like you to speak to how is corruption and counterfeiting affecting global supply chains, especially for critical goods, and what should we be doing about it?
Great question. So it's an important reason, but one of several why we need greater supply chain transparency in this crisis. We need it because what we have seen around export restrictions is disrupting supply chains that we need ultimately to build out new manufacturing sites. When you build a new manufacturing site, it needs a supply chain around it. So the only way we can do that is by having greater transparency where supplies exist and allowing those flows to occur. It's also valuable for this track and trace function that feeds into our anti-counterfeiting effort. And we have seen episodes, not just around masks, which you've correctly identified has been one, but around faulty diagnostic tests that have also played a role in substandard reagents that have gone in a lot of therapeutics in this crisis. So the lack of transparency we have in manufacturing and input supplies is something we have to address. Standing up a surveillance system is one way that we can tackle all those problems at the same time. So it's a critical piece. And we still don't have that with a lot of active pharmaceutical ingredient or many of the other components of what is at issue in this crisis.
And Doctor, I see you shaking your head yes as well. If you might speak to the same relative, especially to some of those reactive agents and the like. Do you concur?
I do. And I have to say, Congressman, I've been worried about this because the history of substandard and falsified medicines, as well as falsified vaccines, is something that has not gotten much attention. I mean, my gosh, we're in a tough enough situation if falsified fake vaccines basically start showing up in the market.
Yeah.
I mean, we can all imagine the complexity and the problems that causes. So what Mr. Bollyky is saying is incredibly important.
Yeah, and if I just might ask both of you too, from what countries or which countries should we be most concerned about? I think I know the answer, but I'd like to hear from you too, relative to where we should direct our attention.
Historically, particularly on the reagent concerns, there have been, and in the active pharmaceutical ingredients where we've seen adulterated or substandard components, the source has often been China. Again, this is a reason to engage in global manufacturing, as Dr. Jha and I have been, and others have been asking for in this hearing, because ultimately, until we provide a compelling alternative, desperate countries will resort to desperate measures in terms of where they get their supplies and medical interventions. And unfortunately, they don't always come with the regulatory oversight we need.
Thank you. Thank you all to our witnesses. Grateful. I yield back.
Thank you, Representative Phillips. We'll now go to Representative Perry for 5 minutes.
Well, thank you, Mr. Chairman. New poll I was looking at said about half of Americans now view China as America's greatest threat. That's more than double since this time last year. I don't think we need to dig very far to figure out why people think that. International institutions have been marginalized by China. You got espionage occurring in universities and our businesses around the United States. And quite honestly, the lies regarding, we call this a coronavirus, but there's a reason we call other diseases or maladies. They're characterized by where they came from, but heaven forbid you say China regarding this one. And of course, the ongoing efforts regarding genocide or against their own people and the bellicose activities towards their neighbors. I think that Washington, we could keep up with the wisdom of a lot of the American people. Now, just as an aside here or related, just yesterday, the director of the Africa CDC was invited as a witness to the Africa and Global Health Subcommittee hearing. Just last year, the doctor was quoted saying that the Chinese government's response to this new outbreak has been swift and decisive, and also that China has made remarkable progress in responding effectively to disease outbreaks. Now, these comments were made with zero corroboration by key international stakeholders, including the World Health Organization. China's presently peddling its cheap vaccines, and you just talked about it, to nearly 40 countries, with dozens more countries pending. We don't need to invite people into Congress's committee rooms who are furthering its propaganda, in my opinion, and especially from a country that's plagued the world with this scourge. I wonder what happened to the demands that Dr. Tedros of the World Health Organization resigned from his post. I mean, a year ago, I think a lot of people were talking about that, and now it hasn't been raised at all in several months. As a matter of fact, he seems more involved than ever, and I don't know how this individual has any credibility. I mean, he's the leader of the World Health Organization, and we're using American tax dollars to pay this organization. This individual praised China for its extraordinary measures to contain the outbreak when it had nothing to do with containing the outbreak. As a matter of fact, it sent millions of people that were potentially infected around the globe. I mean, it essentially spread the outbreak. And now he's leading this COVAX, the main global effort to vaccinate as many as people as possible. And we're here in this panel today talking about potential counterfeit or ineffective vaccines, which will undermine the credibility and the faith that people in the world have about our ability to create effective vaccines. I think we need to use the considerable leverage that we have if we're going to fund the WHO, to have Dr. Tedros removed from his post. I just think that many foreign leaders are under considerable domestic pressure to produce a product and a vaccine with a reported 50% efficiency rate is still better than nothing. However, China's been masquerading its ineffective vaccine as global health assistance, while at the same time providing disinformation about Pfizer and Moderna, which we have paid dearly for in the United States. Maybe this question goes best to Mr. Bollyky. How do you think we can most effectively counter the disinformation campaign being conducted by the Chinese Communist Party and, quite honestly, the Russians as well in this vein?
Great. Thank you, Congressman. There's much in your statement to agree with. There's no question China notified the world late of the emergence of the virus. It's also incontrovertible for a critical period of weeks in January that China did not share material information about how this virus spreads at a time when doing so may have helped domestic infection control, but also to reduce the spread of the virus internationally. I think on the WHO side, I do want to state for the record that I think the case for their performance pandemic is a bit more. WHO prompted a notification of this virus. China didn't notice, report, and ask them to. WHO has coordinated the low and middle income country response to this pandemic on the budget of a mid-sized hospital. So while there's much they have not done right in this crisis, there are some things that they have done well, and we should take the good with the bad in thinking about how to address that institution moving forward. The best thing we can do to counter diplomacy coming out of this pandemic is present a counter compelling alternative vaccines. It really is a critical issue for how nations will be able to respond moving forward to this pandemic.
Thank you, Mr. Chairman. Thank you, sir. And I just think there ought to be some accountability for horrific failures, especially when we're paying for them. With that, I yield back. Thank you, Mr. Chairman.
Thank you. We will now turn to Representative Titus for 5 minutes.
Thank you, Mr. Chairman. I'd like to address this to Ms. McKenna, if I could, please. In your written testimony, you mentioned how the pandemic has erased a lot of the positive gains that have been accomplished over the past few years in achieving better gender equity. Around the world, we have seen that many women were in the frontline jobs. They either couldn't give up their jobs or they gave up everything to stay at home with their families. And yet at the same time, they're the ones who've been spearheading economic development. More women are in political office. They're changing policies like violence towards women. We say when women make progress, the world makes progress. Their agent changes. I just want change agents rather. I just wonder if you could talk about what you and other NGOs are doing to try to bring back some of that loss of gender equity and what we might be doing to help shore you up and promote that cause. Is she gone?
I apologize. I was muted. I'm sorry. Thank you very much, Congresswoman Titus, and for allowing me the opportunity to talk about this. It is one of the more devastating impacts of this coronavirus. Like I said, we've seen erosions in development gains. We've seen increases in food security, increases in violence, and we think there are increases in conflict that are coming. And women and girls are bearing the brunt of this between poor health outcomes, the earnings losses that you mentioned, greater violence towards them, and also the burden of being caregivers, often in multi-generational households with more vulnerable members in those households. It's really important that we, the development community, that me and my colleagues out there, we are really redoubling our efforts towards women and our programming towards them. That includes working with violence preventions with both men and women in their communities, partnering with, we have a partnership with, for example, with the Women's Refugee Commission to pilot this innovative older male sibling and caregiver intervention to change family norms around violence towards girls. We've tried to move quickly to online teaching and providing spaces for digital learning online or through radio or other places, training community givers, providing access for work. One of the things that we've been doing in Ethiopia is domestic workers especially were not able to work. We've created an app and a matching system to find new jobs for domestic workers. We also, in our cash and voucher assistance, prioritized domestic workers who had been laid off, who were particularly vulnerable. So making sure that we look particularly at the ways that this is affecting girls, the different places where they go, the jobs that they have, and working to support those industries first and foremost with our economic activity, as well as with the social needs that these women and girls have now with this virus.
Well, thank you very much. I think this gives us something that we need to work on and support through maybe NDI, IRI, all of your kind of development agencies to promote both economic and political equity to move these policies forward.
For sure. We know when women are at the table and developing the response, they tend to be better responses.
Absolutely. Well, thank you, Ms. Chairman. I yield back.
Thank you. We will next go to Representative Issa, please.
Well, thank you. If everyone can hear me, thank you. You know, dealing with sub-Saharan Africa and other developing nations and areas is always a little frustrating, but I think the pandemic has exacerbated it. The need is greater, but it appears as though there are some unanswered questions, and I'd like the panel to answer one of them. From what we can see, the African Union made a decision to buy hundreds of millions of doses at a cost about 3 times higher from the Russians with a non-generally approved or believed in vaccine versus buying one of the 3 to 5 different ones that would be available at about the $3 range. So my question for the panel is, if the most important thing is to get vaccine to people, how can we justify funding the African Union or helping fund them pay what can only be seen as dubious amounts for a less proven vaccine?
Looking to see if any of my colleagues are going to jump in. Let me start it, Congressman. My sense is that the bigger issue here is vaccine availability and what is actually available to people. The Russian vaccines are available. My personal take is I don't know enough about the Russian vaccine, Sputnik V, Sputnik 5, to know whether I would be comfortable taking it or not. The data is just not there. And whereas I would much prefer that the world get vaccinated with the vaccines that have gone through regulatory approval, you know the list. But those vaccines are not generally available right now because we have bought up a lot, the Western Europeans have bought up a lot. And so countries are faced with a tough choice, which is get the Johnson & Johnson and Moderna, but you may not get any supplies for 6 months or a year, or buy what's available today at the price that it's available today. You can understand why people make the decisions they do. I think part of our job in showing our global leadership is to give people alternatives. So they're not choosing between getting a vaccine that has not gone through the full approval versus nothing at all, but instead have the option and the opportunity to purchase and get vaccines that we think have gone through the rigorous trials that are necessary.
And would you like, I mean, you commented on Sputnik, it's 3 times the cost. Is there any justification other than greed by the Russians that would justify the $10 a dose cost?
Yeah, I want to say vaccine pricing in this pandemic is really strange. I mean, it's not obviously a normal market, right? And people are charging what they can or what they want to, and and for a really highly effective vaccine, you'd say $10 a dose is a bargain if you think about the value that they generate for people. So there may be others on the panel who are smarter and more knowledgeable about the pricing of the Russian vaccine, but I would say my sense is it's much more about availability, and if it's the one available, people are going to be willing to pay whatever the price is.
Well, in a quick follow-up, obviously we're dealing with a population of over 1 billion. The purchase is only for a fraction of that. The same question again, why is it the African Union doesn't seem to be at least buying what could be made available as part of their process at substantially less?
So if you don't mind, I'll weigh in a little bit here.
I'm sorry, you broke up. You wave a little what?
On these issues. Are you able to hear me now, sir?
Yes.
Okay, terrific. I would say what is most of the capacity was locked up by the United States and other nations.
We're still having difficulties hearing you, Mr. Bollyky.
Yeah, I'm afraid it's a little.
Resources slow to get to COVAX, so they it's any better.
Okay, Mr. Chairman, I appreciate. I think
else is they are actually donating.
I'm sorry.
It's coming in delayed. All righty. Again, I'm sorry about the technical difficulties. That was an important question and answer. We will now.
Shall I try again?
Yeah, we're gonna move on to
Mr.
Congresswoman.
Mr. Chairman, I would just ask that anyone that wants to respond for the record, and we'll look at it in writing. Thank you.
Of course, yeah, we'll all have the opportunity to follow up in writing. So I will now go for 5 minutes to Representative Spanberger.
Thank you very much to our witnesses, and thank you, Mr. Chair. I appreciate you recognizing me. So I have a background in intelligence, and I'm aware of the importance of detecting threats early on. So along these lines, I recognize the importance of global health surveillance programs and ensuring that the information gathered through these programs do inform U.S. and global public health approaches. Dr. Jha, in your view, what went wrong in terms of some of our early detection of COVID, and how can we remedy and rectify this going forward?
Boy, I was going to say it's the $1 million question, but it's probably the multi-trillion-dollar question of what went wrong. A lot of things. So certainly, we did not have the kind of global surveillance that allowed us to pick up this disease before China first made the WHO aware. My sense is that this disease, by the time end of December, early January came around, 2019 to 2020, the disease was out. It was out in many countries. We probably had cases here in the United States. But we did not have the kind of surveillance system that would have allowed us to identify this. We have largely in the past, and I think we need to really rethink this, relied on countries reporting their own outbreaks. And every country and every outbreak has an incentive initially to downplay it for the obvious reason that they always hope that it'll just go away and then they don't have to make the world aware. I think that is a second vulnerability. And I think the other part is that we really need independent assessment of these data that are independent of WHO. And again, I'm not somebody who blames WHO for all of this, because they are really confined and constricted by the fact that they are a membership organization, and therefore they can do what their members allow them to do. But you need an independent body to assess it. So we need far better surveillance capability We need a different way to sift through the data, and then we need an independent assessment of that data. We didn't have really any of those things. So in some ways, it is not totally surprising that we found ourselves where we did.
Could you speak just a little bit more to why countries and presumably just an issue of kind of reputation, but are there any other reasons from a scientific perspective, from a public health standpoint, why countries would be slow to report a situation like COVID-19 as an example?
It's largely economic, Congresswoman. I mean, basically what happens is, when I think about like what happened in West Africa with the Ebola outbreak, and there WHO's failures were far more catastrophic. I mean, obviously didn't have the same global impact, but for months, WHO downplayed what was happening in West Africa and in the Ebola outbreak. And really, because the countries were asking WHO in some ways to downplay it. And the reason is, if there's an Ebola outbreak, you certainly don't get much tourism. Trade and travel slow way down, and there's a reputational impact. And all of those things, countries are very afraid to admit those things early on. It's only when it becomes no longer deniable that countries tend to fess up. But often things are the cat is way out of the bag by that time.
With the American Rescue Plan, we included significant resources for COVID testing and tracking, including the detection of new variants, as well as resources to bolster U.S. disease detection and warning systems. Just a continuation on the discussion of what happened at the beginning of the pandemic. Could you just speak a little bit to why disease surveillance, even at later stages in a pandemic like where we find ourselves, are critical, and what public health officials seek to do with that information?
Absolutely. So if you think about the variants that are circulating, B117, the one from the UK, why was it found in the UK? Because UK does really good genomic surveillance. So they identified the case early. South Africa actually does very good genomic surveillance, and they were pretty early to find the B1351. The point is, you can't find these things unless you're looking for them. And this pandemic isn't over, and this virus isn't done evolving. And so if we are not tracking these things, if we are not seeing the emergence of variants from around the globe, if we are not able to understand what properties variants have, we're going to essentially be sitting ducks to new variants that are going to get us into a lot of trouble. So surveillance is not the end all, but it is absolutely the first step. You can't really do much in a disease outbreak if you can't track what's happening.
And in terms of just what you can do with that surveillance information, that's what's allowing, we hear about the research of boosters at different pharmaceutical companies, and that's all a result, not to put words in your mouth, but that's all a result of the surveillance. Is that right?
Absolutely, absolutely. No, that's exactly right. And so if we think about these boosters and when will we need them and who will need them, this will all depend on what happens with these variants, our ability to identify it early, see its impact on the population, make clinical decisions about whether we need a booster or not, who needs the booster, build it, test it, deploy it. There's a lot of steps here, but it begins with surveillance.
Thank you very much, Dr. Jha. Mr. Chairman, I yield back.
Thank you so much, Representative Spanberger. We will now go to Representative Mast for 5 minutes.
Chairman, I appreciate it. Dr. Jha, I just want to make sure you're paying attention because I'm ultimately going to be asking you a couple questions. You did state a number of things in your written testimony, and I love that you didn't have the exact same testimony when you spoke about it. It's always a frustration to hear the same thing that I read exactly, so I appreciate that. But you did talk about we live in a deeply interconnected, interdependent world. And you also stated that it's essential that we maintain basic health measures until every high-risk person is vaccinated. And I want to talk a little bit about travel. CDC issued an order in January requiring negative pre-departure COVID-19 test results or documentation of recovery from COVID-19 for all airline passengers arriving into the United States from any foreign country. Is that good policy?
I believe it is, Congressman. I think right now, the thing I would add to it is vaccination with a high-quality vaccine would be a reasonable addition to that list as well. But I do believe that it is important that we know when people are coming in that they're not coming in actively infected.
Are you aware that somebody right now would have to go through those requirements to fly from Mexico City into Houston or Dallas or Miami or anywhere in the country, but somebody could essentially walk across our border without being tested several days prior or showing that they've recovered by pretty much any name that they decided to use, needing no identification? Do you see that as a risk? If you see it as good policy, that we have that for people that we know that are traveling in? Is that a pretty big risk?
So, Congressman, I do believe that people who come into the United States, irrespective of how they come into the United States, it is good policy to test people before they enter the United States, or obviously have documentation that they've been previously infected or vaccinated.
So by fiat, it's bad policy to not do that.
Well, I mean, I just said, I think it's good policy. I think it's a good way to protect the American people.
All right. Don't be scared about saying it. There's nothing wrong with saying it.
I'm pretty comfortable saying what I think. Sorry.
I see that as a pretty big issue. I think a lot of people see that as a big issue as well. I find it funny when I think about some of the comments that was made by our colleague, Mr. Liu. And I went back and looked at his Twitter, and he said, when Merriam-Webster dictionary defines super spreader event in the future, they're going to show a picture of a Donald Trump rally. And I would wonder, would you classify what's going on at the border as a super spreader event?
Well, sir, I have to say I don't know what's happening in terms of testing and isolation at the border. So it's not something I've looked into closely, sir.
As of the last few hours, they're working to do more testing. There hasn't been a great deal of it, but some cities along the Texas border have taken it along themselves to do some of this because of the risk to their populations. Brownsville, Texas tested about 17 to 1,800 individuals, had about a 6% return rate of those that tested positive for COVID, a little slightly over 100 that tested positive for COVID. And they undertook this because individuals were not being tested. They were coming in. They were essentially being given taxpayer-funded travel into Brownsville and then being released to go off to 7-Eleven or to go off to get on another bus, sit next to mom or dad on that bus or somebody's kids, and travel somewhere across the country. I would say that would be the definition of a national super spreader event. Could you agree with me on that?
Well, as I said, Congressman, I certainly agree that people who come into our country anywhere at the border flying.
What I'm asking about is that parameter meet the terminology of super spreader event. People coming in, they're not being tested. We realize that there's a good percentage of them that have COVID and then are being sent across the country in public travel. Would that be a super spreader?
Well, so the super spreader event has a very specific meaning, which is in a
take a yes or no, not because I don't want to hear you, but because my time is running low, sir.
It would not, as I understand it, classify as a super spreader event, but it wouldn't be a good idea.
I'm glad you agree it wouldn't be a good idea. We can argue about the semantics later. Let me ask you one more question, sir. To stop the spread of COVID-19 into the United States, do you feel that we should return to the, quote, remain in Mexico policy in order to protect Americans? Should we return to saying that people should remain in Mexico instead of being allowed into our country as they're coming to approach our border?
Congressman, I'm not well versed in immigration policy. I can talk about COVID.
No, this is COVID policy. This is COVID policy to protect Americans from COVID. Should we return to you stay in Mexico when you're approaching our border because you haven't been tested? This is COVID policy.
The gentleman's time has expired.
I would say people should be tested one way or the other, and that's really the key issue here.
Thank you for your time, Mr. Chairman.
I will now go for 5 minutes to Representative Connolly.
Thank you, Mr. Chairman. Can I be heard?
Yes, you can.
Great. Let me ask, and thank you so much for holding this hearing. I would like to focus a little bit on two subjects. One is, what is your assessment of how inequitably vaccine supplies have been made available to lower income countries? And longer term, what's the impact of that? That sort of inequality in distribution and availability and supply. And then secondly, what impact has the pandemic had, in your view, on retrogression, on democratic norms, practices, institutions? We had a report that 80 countries have actually backslid on democracy. To what extent does the pandemic make that easier and more problematic for those of us who want to promote democracy as we go forward? So the inequality question about vaccine distribution and supply and the democratic resilience test or backsliding that we're experiencing because of the pandemic or related to the pandemic.
Well, maybe I can start on the vaccine part quickly and inequality, Congressman. It's hard to overstate how big a deal this is. And let me lay out two parts of it. I mean, obviously, just the sheer direct effect that there are millions of people who are going to get infected, many people are going to die at a time where we have vaccines widely available. That in a vast majority of countries in the United States, healthcare workers haven't gotten them, elderly haven't gotten them. And I think that's a huge problem. Here's one very specific angle that I think I would love for us to consider. Healthcare workers in many of these countries are few and far between. There aren't that many doctors, there aren't that many nurses. And when this pandemic kills healthcare workers, which is tragic under any circumstance, it devastates communities and health systems for a generation. And we are seeing the death of healthcare workers in places where there are so few healthcare workers. And the fact that we have not gotten vaccines to these places means it's going to be a generation before these health systems can build back. That will have massive negative effects on health for the next 20 years. So it is, in my mind, hard to overstate the negative health effects of this inequality. This is not just a 6-month delay. Oh, it's not great. It's awful. And we're going to be paying the price, and the world's going to be paying the price for this for decades.
If I may build on that, Congressman, to your democracy question, but I'm actually going to link both of your great questions there. On the inequity side, 400 million vaccine doses have been administered worldwide, 3 out of 4 doses by just 10 countries. Now, you can justify different amounts or quantities of vaccine going to different countries if they were going to where the crisis is the greatest and where they can do the most good. That is not the case. The US is actually, by and large, using vaccines at a similar pace or in similar amounts to our case burden, particularly since November. But when you look at many of the other countries that are consuming large quantities of vaccines, that is sadly not the case. In the meantime, a whole handful of countries, again, Central Eastern Europe, Latin America in particular, are going under enormous surges of the virus, given the fact that they don't have sufficient vaccine supplies. So that is one demonstration of it. When you look at who is donating to COVAX and who is donating to doses, it breaks down by political regime type. Democracies are donating cash. Autocracies or autocratizing nations are donating doses. And that, for countries that have a need to respond to their needs of the domestic population, unfortunately, for some nations, will reaffirm a narrative that democracies have not handled this crisis well. They have not handled it well at home, and now they're not handling it well abroad. So it is incumbent on us, the United States, to present a compelling alternative to that narrative.
I'd like to add a few points on the closing of civil society space and democracy in this. It's actually quite circular. So not only are governments able to use this pandemic to stifle civil society, you also have the situation where citizens are more upset with their governments for feeling like they're not handling the pandemic very well, or that the government's using it as an opportunity for corruption. You also have situations where armed and violent extremist organizations are taking advantage of the COVID situation to gain sympathizers and supporters. So for example, in Somalia, Al-Shabaab set up a COVID-19 treatment center last year to show its commitment to the welfare of citizens in contrast to the government's. So all that will just also create more incentive for governments to crack down on democracy and civil society. So we're very concerned.
I'm sure my time is probably coming up, but I want to thank all of you. Very thoughtful answers and really thought-provoking points you've made that I think our committee really needs to focus on in terms of, once we're out of this pandemic, what's been the fallout in terms of governance, in terms of civil society, in terms of democratic buy-in, and we've got a lot of work to do. So thank you all for your thoughtful answers, and I yield back, Mr. Chairman. Thank you.
Thank you. And I see the Chairman Meeks has rejoined us. So I will gladly pass the gavel back to you, Mr. Chairman.
Thank you, Mr. Malinowski. Thank you for standing in while we had bills on the floor. And I'm told that we've had a very stimulating hearing going thus far. So I want to thank the witnesses for that. I've been getting a quick catch up in that regards. And I'm going to go straight to some of my questions real quick. I'm going to bypass and submit for the record my full statement that I would have made, but I just want to say that, last week we passed the American Rescue Plan, which was a landmark legislation that will provide Americans with the support they need to recover from the economic, health, and social and other impacts of this pandemic. But what I want to emphasize was that included in this package was $10 billion for international efforts, which is desperately needed for global health support on vaccines and humanitarian assistance to combat COVID's impacts in crises areas, and economic relief to make sure that we don't lose the hard-fought development gains that the United States has helped create over the years in education and economic opportunity, and water and sanitation and food security and human rights. It's our responsibility as Congress to oversee this funding to make sure it's provided quickly and responsibly to maximum effect, I should say. And I look forward to hearing and working with the witnesses. And with that, let me just ask my first question that, because I've been pleased to see that the U.S. joined with COVAX under the Biden administration. And this is a multilateral effort to develop, produce, and provide vaccines around the world to stop the spread of COVID, and plays an important role in helping ensure vaccine equity. But this effort is only successful as the sum of its parts. And so my question is, how can COVAX incentivize buy-in from donor countries and demonstrate the value of COVAX facility in the face of competition?
So I can take a first shot at that, Chairman, and thank you again for convening us and your leadership. What I would say is COVAX's ability to increase buy-in is going to depend on its ability to deliver. And ultimately, we are 4 months into this global vaccine rollout, and COVAX has delivered 29 million of the 400 million vaccine doses that have occurred. So under those circumstances, what is important is that we do what is necessary to support COVAX in being able to manufacture and deliver the 2 billion doses they intend to by the end of the year, because again, we're 4 months into that rollout and they have quite a ways to go. One thing I will highlight here is the issue of export restrictions on raw materials are significantly hindering that process. COVAX cannot manufacture vaccines if they can't get access to bioreactor bags, other single-use components, raw materials that they need to make those vaccines. And those restrictions are being imposed by several countries, but it includes the United States as well. Ultimately, it's understandable that the U.S. is prioritizing needs to vaccinate our own population. We need at the same time to invest in the manufacturing that can rebuild those supplies and provide them to the rest of the world.
Thank you, Chairman Meeks, for that. I'd like to add, COVAX covers the cost of the vaccine, but it does not cover the distribution of that vaccine. And so what you're going to have is in countries with weak governance or weak infrastructure, or even places where there aren't governmental actors like Northwest Syria, and other places in protracted conflict like Syria, Yemen, Democratic Republic of Congo, and South Sudan, we're going to have more challenges with the resources to distribute that vaccine and to make sure that we have equitable distribution in those areas.
Great, thank you for that. Now, I mentioned in my early introduction about the $10 billion that we had
put in the rescue plan. So what I'd like to ask is, what's your view as to some of the areas in which the funding will give us the biggest bang of our buck? Where do you think and where do you see the greatest needs in building back from COVID-19 overseas? What would get us the best bang for the buck?
So Chairman Meeks, the biggest secondary impacts that we're worried about right now are it's exacerbating food insecurity, the reduction in gains in global poverty, the increased gender inequality, and the increase for violence and conflict. So there are a couple of things that we'd recommend. And we also, because of the way that the vaccine rollout is and certain countries' access to it, we may not have vaccinated populations really until 2022 and 2023. So there are a few things that we recommend: making sure that we have a comprehensive approach that includes food security, that includes things for women and girls, extreme poverty, implementing the Global Fragility Act, which this committee passed, which really studies and looks at the root causes of that conflict and prioritize. So funding for that act, as well as encouraging the State Department and USAID to act and fund against it to help prevent more conflict from happening. And also really looking at this as a multi-year, long-term development issue, which is what it is because of the gains that we've lost. And so continuing to look at multi-year emergency funding and other mechanisms going into the 2022 Foreign Ops appropriation bills as well.
Thank you. My time has expired. So now I'm going to recognize the ranking member of the Subcommittee on Western Hemisphere Civilian Security, Migration, and International Economic Policy, Representative Mark Green of Tennessee, for 5 minutes.
Thank you, Chairman Meeks, Ranking Member McCall, and thank you to our witnesses for testifying before us today. These committees can go very long, and I deeply appreciate your staying with us, so thank you. Over the past year, COVID-19 had a drastic effect on our nation and our world. Schools have closed, businesses have shuttered, and global stability has been rocked. Per capita incomes in 2020 fell in over 90% of emerging and developing economies. And the secondary effects of the pandemic, such as increases in mental health issues, a rise in infectious disease, delays in diagnosis of cancer, and an erosion of democratic norms, continue to take a toll. Several new COVID variants have also arisen, posing fresh challenges to the pandemic response. Ramping up vaccine production and distribution is perhaps the most important thing we can do right now. Clinical data cited in the New England Journal of Medicine shows that in the short term, the first dose of the Pfizer vaccine provides 92.6% efficacy. That's why I joined Congressman Foster and Congressman Barra in a bipartisan letter to the CDC and the FDA requesting the agencies monitor data from countries that are delaying a second dose, like the UK and Israel. This is certainly something the world should be seriously considering. The faster we roll out vaccines, the faster we end this pandemic. As ranking member of the Western Hemisphere Subcommittee, I'm particularly concerned about the pandemic's impact in Latin America and the Caribbean. Weak health systems have been overwhelmed, economies have drastically shrunk, and political tensions are significant. We've seen widespread protests in many capitals, and Peru had 3 presidents in the span of 1 week. China is seeking to take advantage of this instability, gain a foothold in the region. When possible, the United States must prioritize vaccine distribution to Latin America, which is clearly falling behind. Their desperation has turned many to China's vaccine, which comes with political pressure from Chinese Communist Party, of course. The U.S. and its allies must do more to end the pandemic in the region and prevent China from using a public health crisis for its own political advantage. And my question is really to anyone in the group who wants to take it on. There are well-documented efforts of disinformation campaigns waged by China, Russia, Iran, and others, both against Western vaccine efforts and legitimate questions about the origins of the pandemic. How do these disinformation campaigns affect public health, particularly in the less developed part of our globe?
Well, Congressman, I can get started. I want to just say very quickly on the 1 dose, delaying the second dose thing. I was one of the early people back at the end of December to call for a delay of the second dose. and got no shortage of negative reviews from many people in the scientific community. But I still stand by it that I think that would have been the right policy. And I think we're seeing some really terrific results coming out of the UK and how they've done. But nonetheless, I think that even though that policy may be less important for us now, given that we're getting a lot of vaccines in place, it is still an important part of vaccinating much of the world. And I think getting a single dose out to high-risk people is a very, very important thing. On the issue of disinformation, this has been one of the most difficult challenges of this pandemic, is that I used to believe, naively so, sir, that misinformation was your Uncle Bob sent you some article that he read and you're like, oh gosh, he's sharing bad information again. No, this is very well designed, well concerted, often foreign created, but not always, programs to sow confusion, to create a lack of clarity, to undermine confidence in public health measures. We have seen that throughout the pandemic, and I think we're certainly seeing that now with the vaccines. It's a huge problem, and the best ways to counter that is really find trusted voices that people turn to and having those people counter that information. So it's one of the big challenges of public health, and I think it's going to be a challenge for us across Latin America and the world.
Yeah, as a physician, you don't know this, but I am a physician. I did vaccine research at USAMRIID. I think this is one of the safest vaccines we've probably ever fielded, and done so in rapid time. Yep. So thanks for your comments about that. This is a political national security thing, because China and Russia are using this information to basically destabilize our relationship with allies. So that's why I raised the question. Thank you, and Mr.
I now recognize the Vice Chair of the Subcommittee on Asia, the Pacific, Central Asia, and Nonproliferation, Representative Andy Levin of Michigan, for 5 minutes.
Thank you so much, Mr. Chairman, and thanks for holding this important hearing. Can you hear me okay? Okay.
Yeah.
All right, well, it's good to see you, Dr. Jha, and I want to thank all the other witnesses. I want to jump right back into a discussion about the intersection of public health and foreign policy as it relates to this, to vaccines. Obviously, the United States, we need to vaccinate our public. I'm not going to criticize us. Let's go. Let's get everybody vaccinated. But I don't need to spend a lot of time on how the vaccine doesn't, the virus doesn't care about borders. And if we allow it, even from a self-interested point of view, if we allow it to run rampant, some of these variants are going to come up that defeat the vaccines, and we just have to get the whole world vaccinated. I'm a big supporter of the TRIPS waiver. We had an event on that yesterday. I'm obviously supportive of us giving financial support, but to others, and there's the Quad effort. But I'm curious to hear from maybe Dr. Jha and Mr. Bollyky to start with about how the United States should lead in a global effort that's not just yet another crisis. This is a world historic moment, a 100-year public health emergency, where it seems to me that for many decades, how the U.S. responds will be a huge stamp on our role in the world. So, Dr. Jha, why don't you start, and Dr. Bollyky, if you can each comment on that briefly.
Yeah, well, first of all, I could not agree with you more, Congressman. I mean, look, the bottom line here is that, the two countries that are really most actively engaged in vaccine diplomacy, Russia and China, are not doing it out of sheer goodness of their hearts. They're doing it because they think there is an advantage. This pandemic, like many pandemics, really reshuffle global political order. And the question is, where is America going to come out on this? And I think it is really important to show that a democracy with the set of values that our country has, can be a global force for good in the middle of a pandemic. I think we now are at a point where we will have more than enough vaccines for every single adult in America sometime in May, maybe earlier. This is the time for the administrations to start shifting its thinking about when do we start getting vaccines out to the rest of the world. That's one part.
Is it about money, or is it about vaccines where the tube has an American flag on it? How practically speaking, and I want to give Mr. Bollyky a moment too, because of his whole point about the autocracies and democracy, but go ahead.
No, I would love to hear from Mr. Bollyky. Let me just say one quick thing. I think the issue is, first of all, we're going to have a lot of vaccines that we have bought up through Operation Warp Speed that we're not going to use. So we should get those out to other countries. Second, I don't think this is a money problem. I also don't think this is an intellectual property problem. I think this is fundamentally a hard problem of manufacturing global supplies. We've never tried to make 10 billion doses of a novel vaccine within a year. But American leadership can help close that gap in a variety of ways. Let me turn it over to Mr. Bollyky.
Fantastic.
Great. Thank you so much for the terrific question. And like Dr. Jha, I really agree with its premise. So the United States needs to mobilize its partners through the G7, possibly the G20, as we've done in the past, like the financial crisis, to do three things to ramp up supplies. We need an Operation Warp Speed for global vaccine manufacturing. Multiple members here have said there are a lot of positive lessons that we can draw from that. Ultimately, we didn't just make advanced purchases, we coordinated matched suppliers with vaccine sponsors so that we knew that the inputs would be there to actually make those vaccines. We mobilized those raw materials and made sure we built out the supply chains. We need a global equivalent of that. And that's useful not just in this pandemic, but in the next one. We developed this vaccine in record time, just 10 months. We still lost last year. I mean, we've had this year 3 million lives at least globally and $20 trillion in economic losses with that delay. We need to move faster in future. We need that infrastructure. Second, we need better surveillance that can allow the reduction in what we've seen in the hoarding of supplies that break up the supplies you need to make that manufacturing. We've done that on food security in the response to in past concerns. We built that transparency. We haven't done it on medical supplies. We need it. Last thing I'll say, I completely agree with Dr. Jha on donation, except the one thing I would add to it is we should announce now what the terms and conditions are going to be that we will ultimately donate doses so people can rely on that promise. And we should start building the infrastructure that allows those donations to occur because they need to be appropriately labeled and regulated to get where they need to go.
Thank you for that. The gentleman's time has expired. I now recognize the Vice Chair of the Subcommittee on International Development and International Organizations and Global Corporate Social Impact, Representative Sarah Jacobs from California, for 5 minutes.
Thank you so much, Mr. Chair. My first question is for Ms. McKenna. I know you've mentioned that conflict is going to be a downstream effect of this, and that we need to focus on implementing the Global Fragility Act. I did also notice that in a recent report by Mercy Corps, in some parts of the world, the pandemic has created more opportunities for local communities to become involved in peacemaking processes, especially given the restrictions for international personnel. And so I was wondering if you can expand more on this research and share some examples. Talk about ways that we can help expand these models globally during this pandemic, but also if there are some best practices we can take from this increase in local involvement that we can continue post-pandemic.
Thank you so much for the question, Representative Jacobs, and thank you again to this committee for your leadership on the Global Fragility Act. Indeed, I think one of the things that we've learned through the years in development is that local community engagement and really working through local actors and with local actors is a path to sustainability. And if anything, COVID has accelerated that because people have not been able to go. So I think greater USAID, greater funding support to work with local organizations to further train them, to further share skills with them, and greater overhead. I hate to get just money, but even greater overhead allowances for organizations like ours to do that. We've invested in lots of things around community protection and different compliance things that maybe some more local actors would not feel the benefit of doing. And so really really looking at our ability to work with them and to further empower local communities. The other piece that we are taking very seriously is a community accountability mechanism, and really speaking and spending time with communities to talk to them about what their solutions are, what they need, and being accountable to them for that, and teaching local actors to do that as well. So the more we can do to hear the voice, to act with people's needs and with local organizations will make us much stronger.
Thank you. I appreciate that. And if my colleagues haven't read the report, I urge you to, because there are some great examples of local collaboration there. Ms. McKenna, my next question, I know some of our colleagues have asked about the southern border. I myself represent San Diego. But I was wondering in general if you've seen an increase or a decrease in migration around the world as a result of the COVID-19 pandemic. And do you expect global migration patterns to return to more normal patterns once travel restrictions are lifted? Or is this a more fundamental alteration in migration patterns around the world?
Yeah, I actually just this morning spent time with our team in the Democratic Republic of Congo talking about internally displaced populations. Yes, we have seen increases in migration and movements internally and other places because of the economic stress that's placed on communities and the populations we serve. So with that economic stress, you see migration, but also with that economic stress, you see more opportunity for bad actors to move in and to either providing support or doing other things to take over territories. And so even in places where they have high rates of internally displaced populations, there is quite an increased risk of that, just given the instability that COVID is creating, largely because of the economic conditions that it's creating.
Thank you. And with that, Mr. Chair, I'll yield back the remainder of my time.
Thank you. The gentlelady yields back. I now recognize the Vice Chair of the Subcommittee on the Middle East, North Africa, and Global Counterterrorism, Representative Kathy Manning from the great state of North Carolina.
Thank you, Mr. Chairman, for holding this hearing. I want to thank all our witnesses for their thoughtful testimony, and also for your stamina in staying on to the end and answering all our questions. I'd like to start with Dr. Jha. You have stated that we are entering an age of increasing numbers of pandemics for all the reasons that you enumerated. And you stated that we need to build an infrastructure to withstand future pandemics, not only in the United States, but globally, in light of how interconnected the world is. So I wonder if you could elaborate on the steps we should be taking to build this kind of infrastructure, and what would a fully prepared environment look like?
Congressman, it's a great question, and I will tell you that we really need to rethink our whole strategy on pandemic preparedness. The Global Pandemic Monitoring Board, this was an organization that existed beforehand, the Global Health Security Index. Many people had looked at which countries are most prepared for a pandemic, and most assessments said that the number one was the US and number two was the UK. Tells me that we got something wrong. It suggests that we over-relied on structural issues like laboratory capacity, doctors, hospitals, and we under-emphasize a whole bunch of other assets, public health infrastructure, data. We did not emphasize in any of these exercises issues of social cohesion, political misinformation, governance. There's a set of things that have not traditionally been thought of as pandemic preparedness that we have come to learn is all about pandemic preparedness. And so there's got to be a rethinking of this, and going back to the pandemic preparedness model that the Obama administration left behind, as good as it was, it's not good enough for the new set of challenges. We do need to come up with new strategies for how to deal with data and collecting more surveillance data and managing it. You know, what I worry about, and this is an important issue that we're going to have to sort out, countries like China are going to be incredibly well prepared for the next pandemic because they don't have compunctions around how to use data for surveillance of their populations, how to use a variety of data sources. Like, they do things that we would not feel comfortable in a democracy, and we should not feel comfortable. But we've got to come up with a strategy for not having to choose between security and our values. That we've got to figure out how to use these emerging sources of data. So there's a lot of work ahead of us. Surveillance, data, infrastructure, governance, I can't get to it all in 5 minutes, but I want to say it's a fabulous question, and obviously we'd love to think more with you and your team about how to do that.
Let me go to something a little bit more simple than what you've just described, and that is supplies. I come from a district that's manufacturing, and I had calls from several of my good manufacturing companies saying that they were told by the prior administration to ramp up and make all those PPEs that they've been making for years, but have been cut out for cost reasons because everybody's turned to China for things like gowns and masks and gloves. They ramped up, they got them all ready, and then they missed out on the actual government contracts because they couldn't provide them at the lowest cost and for a variety of other reasons. How important is it for us to maintain a domestic supply chain on things like PPEs and other supplies that we have run short of as we've been able to, well, first for keeping people safe, but also as we've been able to ramp up and get those vaccines ready?
Well, let me quickly say, and others may have more thoughts on this, it is absolutely essential that certain things we have the ability to do. PPE is definitely one of them. The other one is critical pharmaceuticals. The active pharmaceutical ingredient of a vast majority of our pharmaceuticals come from China, and many of them are then made in India. But that poses a very substantial risk to us as a nation. So we really need to rethink our entire manufacturing strategy on anything related to health crises and health security, and ask how much of it do we want to offshore, with whom, what are and there's a broader strategic rethink that needs to happen. But certainly domestic supplies of manufacturing is going to be critical for a lot of these things.
Great, thank you. I have many more questions to ask, but with 35 seconds left, I would get to ask the question and be out of time for the answer. So I thank you all, and I yield back.
Thank you. The gentlelady yields back. I now recognize the vice chair of the full committee, Representative Tom Malinowski from New Jersey, for 5 minutes.
Thank you so much, Chairman Meeks, and thanks to all the witnesses. It's been a really great hearing. And you know, I was hoping that we could get through this without rehashing our debates from early last year, and unfortunately that was not to be. I share the chairman's determination to make our work in this committee as bipartisan as possible, and I think there is a bipartisan common ground on this that reasonable people ought to agree on, and that is that obviously the Chinese Communist Party hid facts about the coronavirus. Obviously, the World Health Organization did not work hard enough to push back against China in those early weeks. But at the same time, the United States government does not rely on either China or the World Health Organization to know what's going on in the world. We knew what was going on in China. The former president was warned repeatedly in January and February. And yet, even after the World Health Organization declared a global health emergency, he repeatedly praised the Chinese leadership, as late as February 29th, saying China seems to be making tremendous progress. Their numbers are way down. We've been working very, very closely. They're doing great. President Xi gets it again and again and again. So let's agree there needs to be investigation of the origins of the virus. Chinese government should be held accountable, but that in no way absolves us of responsibility for what's happened inside the United States. And as for the WHO, let me just ask Mr. Bollyky this simple question. If the United States leaves the WHO, does that make it harder or easier for China to exercise malign influence there?
It clearly makes it easier.
Thank you. I think that's pretty plain. Now let's get back to what we need to be talking about and have covered, I think, quite well. And I'll stay with you, Mr. Bollyky. The United States, we like to do things the right way. We like to do things the equitable way. And the obvious good government approach to how we help the world deal with this crisis is to work through international organizations to deliver resources and let them do their work. But there is, and you brought this out, a tension between that and the legitimate objectives of vaccine diplomacy. And I think you said at one point that the democracies are delivering cash and the dictatorships are delivering doses, which I think is perhaps the line of the hearing. And I wanted you to elaborate a little bit on that and advise us on what is the appropriate balance here between working through those institutions and the United States getting the credit we deserve as a global leader in public health at a time when China and Russia are trying to steal that credit in the way that you've described.
Great. Thank you for the question. So it's understandable that democracies that are answerable to voters are going to be reluctant to share doses at a time where each dose sent abroad is one dose that can't be used at home on a voter or with their loved one. The issue is that autocracies or autocratizing nations don't have the same restrictions, and they are filling that gap. The way that we can work well with multilateral institutions, but also advance a role for democracies in this international crisis that can make us safer and present a compelling alternative for nations, is to invest in global vaccine manufacturing, because that is not what the WHO is doing. And ultimately, it's very little of what COVAX is doing. There is a role for us to increase supply. If we can't share our early doses because of legitimate concerns about what they might mean to share doses at home, we have to increase the pie. If we can't share it, we have to make it larger so that we can address these concerns. And that really has to be our focus.
Okay. Is it your expectation, and Dr. Jha, chime in if you like as well, given that the United States and European Union countries have reserved significantly more vaccine potentially than we need? I know there are variables there that we can't fully predict. Is it your expectation that we will actually have a significant number of doses that we can share? And if so, what is the best, wisest, most effective way of distributing excess doses that we may have?
Great. So with regard to doses, we will definitely have a surplus. The issue of variants may delay when we declare that we have a surplus, because if the virus does spread more easily, we may need to vaccinate higher populations to higher share of population to achieve the same public health benefit. So that is going to delay matters. What we can do is announce in advance that we will be donating and what the terms will be donating and set up that infrastructure. The fact that we're not providing any information with regard to that really puts us at a disadvantage to nations that are quite willing to fill that gap while we wait for more information. How we should distribute the doses should ultimately go where they can do the most good. So COVAX does provide a vehicle for doing that, but it is a WHO mechanism. It's member state oriented. They want to provide doses everywhere in the world. It may be that the countries that need are suffering or having the largest crisis are not where COVAX would immediately send it to. So it's probably pursuing both channels, some to COVAX and some to the nations in greatest need, which at least for the time being is Latin America, which may make some sense from a strategic perspective from the US as well.
Thank you. The gentleman.
I yield back.
I now recognize the Vice Chair of the Subcommittee on the Western Hemisphere, Civilian Security, Migration, and International Economic Policy, Representative Juan Vargas from California for 5 minutes.
Thank you very much, Mr. Chairman. I appreciate it very much, and I appreciate you holding this hearing. One of the good things about going last or semi-last is you get to listen to everything. One of the bad things about going last is all the people that make all these statements and then leave, they don't get to hear the retort. I have to tell you, the rewriting of history today was pretty remarkable. I heard one of my colleagues say, a doctor who testified in Congress said that China was doing a great job. This individual praised China to contain the virus with zero corroboration. Well, it wasn't zero, of course. They were listening to President Donald Trump. If I could just quote it for this is January 22nd. One of the great things about our just signed giant trade deal with China is it will bring both the USA and China closer together in so many other ways. Terrific working with President Xi, a man who truly loves his country. Much more to come. January 24th. China's been working very hard to contain the virus. The United States greatly appreciates their efforts in transparency. We'll all work out well, in particular on behalf of the American people. I want to thank President Xi, January 29th. And honestly, I think as tough as this negotiation was, I think our relationship with China now might be the best in a long, long time. And now it's reciprocal. Before we were being ripped off badly. Now we have a reciprocal relationship, even better than reciprocal for us. January 30th. China is not in great shape right now, unfortunately, but they're working very hard. We'll see what happens, but we're working very closely with China and other countries. February 7th. I just spoke to President Xi last night, and we're working on the problem, the virus. It's a very tough situation, but I think he's going to handle it. I think he's handled it really well. We're helping wherever we can. I could go on and on because he kept saying that. And of course, it wasn't going well. He knew it. Everybody knew it. And it really is unfortunate. But, the facts are a tough thing, as John Adams said. And these are facts. I wish my colleagues on the other side were here to hear them because they love to talk about how the World Health Organization was doing well. It was the president, too. It was in cahoots. Now, Dr. Jha, I have to ask you this. You said something very scary at the beginning of your testimony. I think you said this: we are entering an age of pandemics. I think that was a quote. And then you went on to parade the horribles, climate change, deforestation, and all. I know that these questions were asked by one of my colleagues, but that really was scary to me, this age of pandemics. And you were talking then about in your answer that we need the infrastructure, but I just don't see that materializing. I don't see how we're going to prepare for this because we seem to be thinking not that this is the age of pandemics, that this is a 1 in 100 year event. That's not 1 in 100 year event. I think it's come back. Could you comment on that?
Absolutely, Congressman. And I'm not trying to be scary, but I think we have to be realistic about the world we're entering. The number of novel diseases that humans have encountered has gone up dramatically in the last 30 years. And largely because most novel diseases in humans come from animals, and human-animal interactions have changed very substantially in the last 30 years, largely due to environmental changes, economic growth, and then climate change is really driving this. And then put all of that in a world which is as globalized as it is. I always remind people that China 2003, the original SARS outbreak versus China 2019, 2020, totally different countries. The amount of internal and global travel out of China was about 7-fold higher in 2019 than it was in 2003. So a disease outbreak that begins in one city, in one town, is across the world within a day or two before anybody's had a chance to detect it. That's just the reality. And we're not going back to a world where we're going to shut down global travel forever, right? So we have to live in the world we're in. And that means we've got work to do. We've got work to do to build this. And if we see this as a 1 in 100 year event, we are going to find ourselves in very much the same situation. And I think the one area where liberals, conservatives, Democrats, Republicans can all agree on is no one wants to go through another 2020 again. And I think there's a lot we can do to prevent it, but we got to get going as soon as this pandemic winds to an end.
And I agree with you. I was in the insurance business for a while. One of the things that was interesting, we called these big events CATs, catastrophes. We had a 250-year event, a 100-year event. These 250-year events, because of climate change, are happening about every 25 years. So what was before is no longer the case because of climate change. And we really do have to change the way we're doing business. And again, I thank you very much. My time is up, but I appreciate very much all the comments. I got to hear so much today that I think is positive and also scary. Thank you.
Thank you. The gentleman yields back. And he is the last witness. And so I want to thank all of today's he's the last, I should say witness, he's the last member. He was testifying a little bit, but so I want to thank all of our witnesses today for their testimony. I caught some of it, but I've been getting words back from members even on the floor, how good you were and how informative you were, despite the questions. You were able to get back with relevant information, and your testimony dealing with these efforts to combat this COVID-19 pandemic is so important. Let me also thank the ranking member, McCall, and all of the members of this committee for their participation today. This pandemic is the greatest challenge the United States and the world has faced in generations. And just listening to Dr. Jha, we've got to be prepared for now and in the future. We cannot relax and take it easy. And what we've learned, I think, what is clear, is that no country can overcome this global health, social, economic crises alone. And as indicated by all of you also, therefore, we've got to make sure that we're preparing and working in a multilateral way with countries throughout so that we can make sure that we never get to this point again. Because if it's left, this disease, this virus, if it's left unmitigated, the COVID spread around the world will lead to further mutations that we've been talking about that threaten our own public health here at home. So you think that we're safe, but we're not until we get rid of it everywhere. And I believe that the United States is in a position to work with the global community in helping distribute vaccines equitably around the world. And I and the members of this committee will continue to work with the Biden administration however we can to make sure that we beat this virus once and for all and be prepared for any in the future. That's extremely important. You can't relax. If there's one thing that this virus has shown us, and as Dr. Jha just indicated, in the world that we currently live in, to think that this is only going to be once in a century is a fallacy. And so we've got to do all that we can and coordinate with countries around the world to make sure that everybody is working collectively together. So again, thank you all. Thank you for being patient. I know there's a lot of questions, a lot of members, and you were here from the beginning to the end. I was able to do 2 or 3 different things and still got here before it was over. So I know how it has been for you. We thank you all for being here, for doing that. And with that, this hearing is now adjourned.
Thank you.
Thank you so much.
Thank you so much for this opportunity, Chairman.
Thank you.
Thank you.
Dr. Jha, we'll see you on CNN.
Sounds good. Bye-bye.
Bye-bye.
Thank you, Chairman from UPS.